Muted.
Good morning and welcome to the Board of Commissioner meeting for April 22nd, 2025. It's 9 o'clock. We'll get the meeting started. Could we call to order, please? Roll call.
Janat,
Here.
Markey,
Here.
Nye. Here. Roloffs.
Here.
Bowers.
Here.
Trigg. Here. Worsakki is excused.
All right, Bob, if you do the invocation, please.
I'd be glad to. Dear Lord, thank you for the opportunity to serve the citizens of Benzie County. I would ask for your guidance today on the decisions we will make today. Please keep all of our public safety personnel safe and free from harm. I ask this in the name of your Son. Amen.
Thank you. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You. You had the agenda in advance of the meeting. If there's no deletions or additions, I'd look for a motion.
Trigg moves to approve the agenda as written,
Presented.
presented. Thank you.
Oral support. All right, again, any comments, questions on it? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed, same sign. All right, so you have the minutes of April 1st in advance. Tammy, was there any changes?
I made the corrections. I had put MACC for Mac instead of MAC, so I made that correction.
Is there any other corrections or additions to the minutes? Hearing none, I'd entertain a motion.
Marking a motion that we approve the meeting minutes.
Trigg will second.
Okay, all those in favor signify by saying aye.
Aye.
Opposed, same sign. We'll have the closed session minutes now.
Now I move to approve the closed session minutes of 4/1/25 as presented.
Your support?
Markey will support.
Thank you. Questions, comments? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed, same sign. All right, we're to our first public comment. Would anybody like to address the group? Mayor?
I just wanted to take a minute to thank all of those involved that item F on your agenda. And especially Commissioner Nye for her 2 hours of negotiations that she did make happen. Wanted
Very good, thank you. Would anybody else like to address the commission? If not, we'll close public input and go to the elected officials and department heads.
Morning.
Morning,
See
Rebecca.
them all pushing me to you. Good morning, Rebecca Huber's Office of Emergency Management. First, I have a list actually, but it's small in size. I first want to say that this is National Volunteer Week, April 20th through the 26th. And you all know that I have many volunteers that work out of my office and that we work around, but it's not just my office or Benzie County. Benzie County government, Benzie County as a whole functions better because we have volunteers contributing parades, civic events, trails, parks, emergency response, libraries, senior services, you name it. So I just want to make sure that if you see a volunteer, that you recognize a volunteer, because our volunteers are what makes Benzie County great all the time. For this week. I'm still visiting your communities, your community governments for debris management and disaster recovery planning. Debris management, not the same as materials management. That's a different plan going forward. We had a recent highlight in the media, if you saw it, regarding our victim services unit. They're headed to a conference later in this week, but again, a handful of really great people who get up in the middle of the night to deal with other people's trauma. And then tower connections we're still working on tower connections, because again, we're touching Vanderbilt, and they had some disaster areas up there. But we're having more testing and connection conversations and less construction conversations, so we are moving in the right direction. We're to that point where we're gonna start talking about testing. We did rock, paper, scissors in the back, and the sheriff said, you go ahead and talk about the search on North Shore. You probably saw if you didn't see the cluster of things going on the North Shore, we had a young gentleman who was visiting. He is from northern Michigan, but he was visiting this area, not familiar with this area. Boys doing teenage boy things out in the evening. He ended up getting turned around and lost in an area that eventually he'll come out, but there's a lot of woods and topography and all kinds of things in that particular area. So he got turned around. He did spend the night in the woods. He did come out on his own before noon next day. So it was quite the hike for him. But between the time that he was reported missing and the time he came out, we had arranged a whole pile of services that were helping and searching. We had helicopters, we had canines, we had volunteer search groups from all over the state. There was a gentleman who came up from Indiana. There's just a lot of people coming together to make sure that hopefully had a positive outcome. So, the longer a person's in the woods, the more you try to think of what alternatives there could be, injuries, those types of things. So we're glad he walked out on his own, and everything turned out great. And again, there was a wonderful response from Benzie County. There was more on my social media page if on the other agencies that were involved. Any questions for me on any of those?
Thank you.
Thanks.
Please, Sheriff.
Morning, Sheriff Kyle Rosa. I wanted to follow Becky with that because I want to compliment her on her efforts in that lost person, and seeing that group come together and all the assets and the resources that we don't know until you need them, and you start making phone calls and they start showing up. It was unbelievable. I didn't take part in the initial the night of, but the next following throughout the night I was being updated. But the next morning I went and helped out to kind of relieve them. Under Sheriff was with Rebecca and so on. But to see the number of people that started showing up from these search and rescue teams that are trained to do what they do with canines and all of that, it was amazing. But to their credit, to Rebecca's credit, she made because we've had these things happen in the past, she knew that she needed to call them early so they could assemble, because they do come from everywhere, all over Michigan and into Indiana. They were showing up with trailers and people and equipment, and you wouldn't believe it unless you saw it. So thank you, Rebecca, for that, and the community for reaching out. We had community support from Porta Johns to donuts and coffee for the workers, the volunteers, and all of that. So it was great, and the outcome couldn't have been better. So family was very happy with that. So thank you, everyone that was involved in that. On the Hill, Had a recent deputy retire after almost 22 years, Marty Makowski. Going to be talking about him a little more later. But he retired from here and went up to, took a job at the tribal police up in Buttons Bay, Town. So we were able to quickly replace him. We are, once again, we're blessed with employees. For whatever reason, they're waiting at the steps. And so we've hired Charles Drager to take his place on the road. Charles Drager actually started in our jail, and he did some Marine work for us as well, but great kid, Air Force veteran. He started in our jail, had visions to become a police officer, went through the police academy, got hired by the tribal police. Anyway, fast forward, he's working for us now. So we kind of traded, but not quite. There was a little gap there, but we're very fortunate to be fully staffed again and continuing our mission, and that is keeping community safe, Benzie County safe, and we have a great group of people. And the jail side, we have a couple that have been in the process, corrections officers in the process, meaning the hiring process. We have a full-time position available or open, and we're going to hopefully try a part-time position that may lead into a full-time later, but two great candidates. Hopefully soon they'll have completed all the pre-employment stuff and start working. So things are going well up there. Any questions?
A couple if I could.
Yes, sir.
First, with respect to what you focus on annually for training, can you share with the public what you're focused on for this year?
Well, we have a lot of training that we're doing. But as we move on and things change in our community, in the world, our trainings have changed as well. We have to concentrate on mental health and all of these type of things now. And so that's one of the big components that we've been focusing on lately, actually for the last year or so, is mental health recognition, what to do with folks, how to deal with them, talking through problems instead of just acting, that kind of thing, being less aggressive, if you will. Our budgets, as you know, we've been looking and having different avenues for funding so that we could increase our training, and we're able to send officers to various trainings because of that added fund. So we've been focusing on, as well as the mental health aspect. We've had officers going to evidence tech schools so we can process scenes, criminal scenes. We've had officers going to recently accident reconstruction type schools. That's a very lengthy thing. So we have two deputies that are now involved, but one has just started the process, and it's a series of classes that they go to. So that's another thing that we've been doing actively, trying to be proactive with responding to these calls that we have. So
You may have already said that when you and I were speaking, you have them focusing on de-escalation techniques.
yes,
Both for,
that's the verbal part of de-escalation. Sure.
and I'm not sure if this question goes to you or Rebecca, but you were talking about citizen response over the weekend. Do we reciprocate for other communities?
Oh, we absolutely do. Yeah. We don't typically go to Indiana, but yes, we have mutual aid agreements with all of our neighbors in northern Michigan. And we're called upon quite probably more than the average person thinks for different things. Sometimes it's just being proactive and showing that we're prepared for anything that might happen, and then nothing happens, but we do have reciprocating agreements and mutual aid responsibilities with others in our area. Well, yes.
And I know one of the things we don't talk about a lot, Sheriff, is the things that we partner with, like TNT as
TNT the drug.
TNT,
Mhm.
and there's some other things that you cooperate with. You want to just outline a couple of those for the public?
The mutual aid emergency response team is another one that we participate in. We currently have two operators, and operators like a SWAT person, for lack of a better term. These teams are called for high risk situations and throughout our region pretty much. And we have a hostage negotiator that's on that team. Deputy McKinley, he's phenomenal at that. And we also participate in our mutual aid dive team. The reason we have these mutual aid things is agreements is that all of us are up here in Northern Michigan are smaller agencies, so we don't have the ability to have full-time SWAT teams and full-time dive teams and all these resources that are ready to go when we need them. So we participate by giving assets and people to these teams, so that when the call comes out, we all get together, or they all get together, and they form a team, and then they train twice a month, most of them, to be good at that. So when the call comes out, teams assemble and they go to wherever the call is needed and handle business.
Great
Yeah.
job. Thank you.
Yep. Yes, sir.
Anything else? Great. Thank you very
Thank
much,
you.
Sheriff. Is there any other department heads or? John?
Morning, folks. Good to see you all. I'm John Troop from the Benzie Conservation District. I don't have any, heroic stories of rescues, but per usual, I'll be talking a lot about water quality here in Benzie County. For the benefit of the public, our mission is to preserve and enhance the natural resources of Benzie County. We're not technically a department really, but a really strong, close partner of the county. And so a couple highlights. It's been a busy winter, gearing up for an even busier summer coming up. A few of the high points. We successfully received our Michigan Invasive Species Grant Program funding. This is renewed a couple times for us. It's an extremely competitive pool of money. We've been running our Aquatic Invasive Species Pathways program for about a decade now. And I don't need to tell you that, our water resources are absolutely critical here in Benzie County. And when we send community surveys, water quality and aquatic invasive species are, top 3 concerns of our community. And so we're thrilled to bring in this state funding to continue to support that program. It's a little less than $100,000 over 2 years. And what this will allow us to do is to continue the mobile boat washing throughout the county. And then it's also, you could think of it as a mini research project. A lot of the issues we have here is that we don't know what we don't know. There are many, many inland lakes spread across the county and beyond, and we simply don't know what species are present or absent in these lakes. And so we're going to be taking the data that we've gathered over the past decade, looking at boater movements, where are people coming from and going to, so where are they likely to transport species from and to and between lakes, identifying where we have gaps in data, and surveying more lakes for aquatic invasive species. So this is going to lay the foundation for the future of aquatic invasive species management for years to come. So we're really excited about this grant funding. I could talk, more about that, but that's the high points. Another source of grant funding, we're thrilled that we received $150,000 from Rotary Charities in Traverse City for our Watersheds Coalition. Again, we've been hosting the Benzie Watersheds Coalition for more than a decade. We are now the Northwest Michigan Watersheds Coalition, recognizing that, natural resources and water doesn't recognize political boundaries, right? So we're partnering with our friends in Leelanau County very closely. and also Manistee and Grand Traverse counties to recognize that there are many, many entities doing phenomenal work to support water quality, but they're doing it in their isolated silos, and that we're stronger and we're better if we work together. So this funding will enable us to hire a watersheds coordinator for 2 years, full-time. Our goal in the interim is to bring in funding to make that more sustainable. But we'll at least have a watersheds coordinator for 2 years to pull together these efforts and bring new participation to the Watersheds Coalition to protect our water quality. Without talking all day about it, to sum it up, we have really phenomenal water quality in Benzie County. I don't, you know, that's almost a given, but some of our water quality monitoring that we've done and some of the headlines in the news are showing us that our water quality is at risk. As we continue to welcome new people to our area, as we continue to develop our shorelines and, you know, land use practices change, and land cover changes, our water quality is going to be facing increased pressure. So this program is designed to protect our water quality for the future. Very similar to the invasive species grant program. We're going to be taking an assessment and setting the foundation for the future of protecting our water quality for future generations. So we're really thrilled to have these two sources of grant funding. If you don't know, about half of our funding comes in from the millage, supported by the commissioners in the community. The other half comes in for fee-for-service work and these grants that our staff bring into the community. So thrilled to be able to do so. And then another small fun grant. We're really excited. We got 2 small grants to produce the Benzie County Nature Journal. I should have brought in some for the audience today, but stop by our office downtown Beulah. These are little booklets that are designed for 1st through 3rd grade kids to give them something to do outside. Look for some different trees, insects. Oh, good. Check out the different rocks you can see in landscapes and give them an opportunity to explore. So we've distributed these to all Benzie County public schools. We're branching out into private schools, summer camps, you name it. We've got many more left, so we'll be distributing these very widely. And if we want more, we've got the blueprint. We can produce more. Looking ahead, I also want to share a note of gratitude to Rebecca for calling out volunteer. In a previous life, I was a volunteer manager at the Regional Land Conservancy, and I just can't. She said it best. Volunteers make the world go round, and that's especially true in Benzie County. We've got a number of volunteer events coming up, including our river clean sweeps. So Betsy and Platte River cleanups, garlic mustard removal at Railroad Point, you name it. So those are live now, as well as some other fun events, nature journaling on May 10th, river tours, things like that. So check out our website for our public events for the year. And then this year, we will be, in terms of lake monitoring and water quality monitoring. I mentioned some of it already. We will continue our long-term monitoring of Crystal Lake, Platte Lake, and their tributaries and rivers. This year, we're going to begin for the first time supporting the Sanford Lake Association and the Long Lake Association in Grand Traverse County with their water quality monitoring. And then every year, as much as we can, we also, on a rotating basis, get to several inland lakes that don't have an association, that can't afford to pay for monitoring. So this year we'll be hitting Davis and Sweet Lakes over near Lake Ann. So we can continue to have a broad picture of our water quality in Benzie County. I could say more, but that's good enough for now. Any questions?
Yeah, just asked if folks want to participate in the cleanup. Should they go to their website for dates and times and who to connect with?
That's exactly right. Yep, we've got an events page right on the website. There's a link there and a link to register live right now.
Okay, great.
Any other questions? Thank you for being here, John.
Morning. Bridget Hassig with Benzie Senior Resources. I'm 10 weeks in and doing well, and thank you for your support. And the good news is that Benzie County is literally an amazing place to grow older. There is no bad news to that. I'm happy to report. And that is primarily because what we just talked about with volunteerism, the millage support we get, the federal and state support that we get and the grants that we're able to get from local providers. I've been and worked in number of different areas in the United States, and this really is a very unique community in terms of its assets. I mean, there are challenges everywhere, but we are able to address those service challenges with the different contractors we work with our team, with the volunteers. And a great example is we just wrapped up our AARP tax assistance program, where we served over 200 clients with 2 skilled volunteers. And so it was an incredibly intense season, and they were relentless and tireless and did a beautiful job. And they've been with us for quite a while. So we have that in so many other areas, our home delivered meals, obviously, at least 50+ volunteers that we have. And those individuals drove through this winter. So they took the season and embraced it, and were able to get the home delivered meals out in a timely basis. So that people had not only the food, but they had a touch point with a human being with at least once a day during the week. So that's very important for eyes and ears for us. I've been focusing on people, process, partnerships, and place. I did not intend for those to start with P's, but it's great for my mind. With people, in terms of internal, I'm really focusing until probably the end of the fiscal year on working with the team, developing the team, making sure that we're operating efficiently, responsibilities are in place and clear, expectations. We've also developed a culture of values. So we've taken the Benzie Senior Resource values and actually begun to make them actionable. And so we have them in the evaluations, we have them in the job descriptions, we have them in our daily meetings, and now we're beginning to roll it out to the members that attend, as well as our volunteers, so that we have a culture of values that recognizes how we interact with each other. And when there's a problem, we go to the values versus the he said, she said, things like that. So we're really trying as a workplace culture to better elevate solutions and be able to be respectful to each other on a daily basis. And so it's something we're really embracing too with our members as well, so that the team knows how to graciously, firmly, but also compassionately respond when we have some incidences that come up. And we do that with each other as well. So it's getting comfortable with boundaries too. The process, we are taking a look at, we have over 5 or 6 software platforms actually, and we're trying to bring that down to just 2 that will allow us to track everything that we need. One is Salesforce. And Salesforce has the ability to manage our donor database, all of our volunteers, all of our clients, everything we need to report to the state. And so we're going through that process, and we're also updating to QuickBooks Online and also their payroll support. That's very important because right now payroll is very manual, and it takes 5 days to be able to prepare payroll a month. And that's about a $3,000 cost, where we could redirect staff time if we automate some of that. So we're taking a look at being able to do that as well. In terms of place, it's really more right now, nonprofits are really challenged to just do instead of stop and do some strategic planning. And so we're doing that, but we're also going through physically the office with all the things that we have acquired over the years to make sure, do we need these? Is it really creating a safety or fire hazard? How can we best take care of all the things that we've acquired over the years? That also includes records retention. We have a number of records we can actually let go of, and we meet the IRS requirements and then the state and the federal requirements too. But we can go through that now and actually allow ourselves to get another room to be able to have more volunteer space and staff space. So that's one of the things that we're working on without physically changing the structure of the building. Our partnerships, I'm super happy to say one of our first partnerships we're doing with our home delivered meals clients is with the Darcy Library. Thank you, Christina. And so what we are looking at doing is 2 things. We are focusing very hard next year, and do right now anyways, on food security. I don't like saying food insecurity, because what we want to do is actually have more abundance with food security for older adults in our county. That's 2 different places. That's what type of nutrition do we provide? How do we make people learn to use food in certain manners? And then also our home delivered meals clients. While they are the recipient of a meal, we are always aware that that's the only touch point they have. And we strongly believe that an older adult can actually still expand as long as they have adaptive strategies. They don't have to become complacent. They don't have to become depressed and just sitting in their home. There is the ability to embrace a different life with adaptive strategies. And so For instance, we're going to be making sure that we can get a library card out to the home delivered meals clients. They can let us know what type of books they want. We can get them out to the home delivered meals clients. So the intent is to be able to balance out what isolated older adults receive and also what the gathering place can provide. And not that it's unbalanced. And so we're looking to balance that out. So partnerships is extremely large, including with Bacon, the Community Action Agency, the Board of Commission, and other organizations as well. We also are taking a look at, space is always the most valuable asset we can have. One of the things that we're looking at is what can we do within the existing footprint and where can we set up satellite partnerships? Meaning, what can we do when the aquatics facility comes in? Can we set up classes there? Can we contribute millage money to people that normally couldn't access those type of places? So we're looking at creating satellites of opportunity versus just we have to grow bigger and we have to provide every service. So we want to be really good stewards of the funds that we receive from the community. One other thing, and I have my executive director's report. I'm sorry that didn't get to you in your packet. We're working on process, but I have a hard copy for each of you, if that's appropriate to, okay, thanks. And with you being a commission on aging and holding that for Benzie County, the Area Agency on Aging out of Traverse City is in the process of doing their next year's annual implementation plan. So I went to the public hearing and, represented our interests. But the one thing I wanted to make available to you all is what they are looking at for fiscal year 2026. They do 3-year planning and 3-year funding with the state, but they also do and update their annual implementation plan each year. And so that's something as a Commission on Aging, you would definitely want to be able to see. I'm happy to say that rural older adults is the #1 priority. And then it goes into other vulnerable populations. There's probably a little star in some of these copies. The only other thing that was a little challenging is that the 55+ population is the fastest growing homeless population in the area that this Area Agency on Aging serves. And so that's something that we're keeping attuned to. It's certainly a much larger issue, but that was a little surprising to learn that. And then last, Older Michiganians Day is on May 7th. And we are looking basically to have a platform of a little bit of an expanded funding, but really digging in on Medicaid choice and med waiver choice for older adults, as well as support to caregivers. We call them care partnerships because a caregiver and a care recipient can create kind of an unbalanced relationship that we see with our clients. And so in these partnerships, we're looking to be able to make sure that the care provider knows how to work with an individual that may have decreased capabilities, meaning you don't correct. There are certain ways to work with and keep that family relationship intact, especially if it is a family relationship. And our home health aides will be going through some ageism and how to speak with the patient's training over the next coming months. So we're looking forward to that. But this is an advocacy letter, which you can individually sign. They didn't give us much time, so I couldn't present it to you and ask if the Board of Commission through Katie would be willing to sign it, but this is an individual letter that can be signed and I can pick them up, or however you can just let me know how to best pick it up. And I'm official. I have business cards, so I wanted to pass those out. So you can feel free to reach me. Are there any questions?
Bridget, I appreciate you being here to present today.
Yeah, that's good to see you.
All right, you too.
Thanks.
We have, we're gonna pause department heads and go to our 9:30 presentation. Katie, you wanna take that?
Yeah, so today we'll have a short presentation from Chris Parrish, who's with our EMS department. He's one of our paramedics. As you know, various staff from the EMS department have been coming periodically to just kind of inform the board on all things EMS, ALS, and Benzie County. And so I'll invite Chris to the podium and he is going to go through a little presentation he put together for y'all.
Good morning, Chris Parrish, Benzie County EMS. In reference to the search and rescue, I was there Saturday morning and I too was humbled with the number of CERT members, Sheriff's Department, State Police, and remarkable. That was great. And interestingly enough, Benzie County reciprocated a little bit the day before when I was at Green Lake, and Cherry Growers, which is now Matern, had a significant structure fire, and that's commercial. And Dayton Frost from dispatch, but there's the Inland Township Fire Chief and his staff was there for a lot of hours and really appreciated. So we do collectively work together, and that's kind of neat to see. But okay, thanks, Katie. I wanted to talk about two topics. One is our education and our recruitment programs. They have sort of evolved and developed over the years. Maybe people do or do not know this, but mine started here, literally at the Elmira Township Fire Hall, probably back in 2008. And probably my first clinical ride was at Benzie EMS Station 2. So Matt Delzio, who was here last time, also, he's here because of doing clinical time at Benzie EMS. We recruited him out of a training program to come ride with us, to learn with us, and magically became an asset for us. Clinical sites are when you go through an initial training education program, you have the opportunity and requirement, hundreds of hours in a paramedic program, maybe 20-ish for an EMT program, where you go and you ride with an agency. We are one of the most requested sites for that for a variety of reasons. And that's where we cultivated our relationship with Matt Delzio, for instance. Our staff works with those education programs. There's really three, and several of us actually work in the classroom with them. It's a separate job, but the purpose for doing that, it's supported by Tom and the department to some extent. We go there to teach, to practice, and also it helps us introduce those students to our service and helps them feel comfortable about coming here to do clinical time with us. Several of us do that. We also participate, and they have practical events there, and then in the field externships at the areas. If there's any questions, just interrupt me, okay? Because I sometimes say stuff. Sometimes it's by accident. Our clinical setting is unique. We have long transport times. We're pretty busy. We don't have a lot of other ALS departments that can just jump over a township line and help us. We don't have that. So we need fairly professional, skilled, experienced paramedics. And what that gives, these combination of skilled staff with good experience, long transport times, busy call volumes, gives those students a real opportunity. In addition to that, culturally, we have a big commitment by the staff and the management to support students. Every paramedic started as an EMT, and every one of us went through this process, and every one of us, especially myself, was probably a little bit of a challenging student. So we've made a commitment to those students to really work with them and try to make them better. We have an instructor coordinator is, in addition to your EMS license, it's an instructor coordinator. It's a separate medical license with continuing education, and it's fairly significant. We have three full-time ICs that are also paramedics at Benzie County EMS. That's nice. And we've got two more that look like they're going to follow. Another way that we can provide a really excellent educational experience. What do we get out of that? Well, on average, we get 3 employees out of every class. That's a good number. That's where we get most of our excellent staff. They learn our system and our practices while they're here as students. A little bit of work for us, a lot of work for them. We don't pay them for that. We have to go through the trouble, but they get that. We can then determine mutually if we're a good fit. Do they want to be here? We want them here. So we get employees in this way. Even if they don't choose to work here, they get familiarization with the system, and we got to help the other areas develop their staff to make them better, and it's something we can give back. Clinical contracts. A clinical contract is simply an agreement between really the 3 education organizations, like Great Lakes Education Coalition, which is MMR, West Shore Community College, and the Northwest Regional Fire Training Center. We have contracts with all 3 of those. The most valuable one to us is Great Lakes or MMR out of Traverse City. That has just worked well for us. We're currently having a little problem with that. Tom and Katie are working diligently to get our clinical contract reestablished with MMR. But any help you can aid in helping us get that done would be great. It's been almost a year. And that means we don't have students from there. So if you can help that, it'd be great. They are working on it. I was hoping I was going to be able to present that we finally crossed that bridge. All right, I'm being hurried along. Value and efficiency. I'm a little bit of an analytical numbers person, and it seemed as though the board likes to look at where we are in comparison to others to determine efficiency and value. Where are we at? Well, in our view, we find ourselves difficult to beat for efficiency, but that's my opinion. So I have some objective findings that can help you maybe see that also. Most EMS millages in the state are about 3 mills, and we're not even 1. So that's one thing that we don't charge as much as we maybe could. So the equation, the picture that I'm going to show you is again, my goal was to come up with a simple, objective way to compare or look at our service. Okay. So calls per taxpayer dollars or millage simply divided by the number of calls for service. So in this equation, calls are any call for emergency services, medical services that we're dispatched for, and the cost is the actual millage. I could get these numbers real easy, and they're numbers. There's nothing, and all it is calls divided by cost gives you a number. So there's very little subjectivity to it. One thing I will point out, in this equation, billing for service, whether like in the fire service, if you have a house fire, heaven forbid, your insurance company typically will get a bill and they normally pay. And that's called cost recovery. It's viewed as a reduction in expense. So in this equation, I can't take into account billing recovery from any agency. I could from ours, but no one else's. So that is left out. That is considered cost recovery, which is a reduction of expense rather than a point of income. So I just want to be clear on what this is. This is just a snapshot comparison of what the taxpayer pays and what they get. So Benzie EMS, depending on when you start the counter for the year, we're about 2,600 calls a year. Again, for emergency medical service, we're dispatched for. We collect about $1.23 million in millage money. The call log was simple. Dispatch had it. I can see it. Public record. Millage collected. It's easy in Benzie County. I can ask Katie, the treasurer. We can see what that is. That gives us $473.60 per call. Well, what does that mean? We are a transporting ALS BLS agency, and there are differences. So the people around us that do a similar job are similar but different. But we can take a look at where they're at. I work for Green Lake Township Emergency Services. I was there on the fire department since I started my career. I helped them go ALS. I was there on that commercial fire at Cherry Growers on duty. They are an ALS BLS transporting fire department, so they are different. 80% of their calls are EMS. That is pretty much the standard in a fire department these days. They run about 770 calls a year. Grand Traverse Central Dispatch furnished that information, and the treasurer gave me their millage collected at $1.232 for the sake of argument, $1 million, giving them a cost per call of about $1,600. They do provide a little different service, and they're not as busy, and that drives them to be a little less efficient, but that's where they're at. Matt Delzio is on Long Lake Township Fire Department. He actually helped them develop as well. Similar to Green Lake, ALS, BLS Transporting Fire Department. Again, 80% of all their calls are EMS, and they run 735 calls a year and $1.9 million. Again, Grand Traverse Central, the source of dispatch number, and Matt got that from the treasurer, giving $25.85 per call. The last one, again, is even more different than the rest of them. Elmira Township, they are a BLS only transporting fire department, and they are part-time staff. An ALS department, there is no moment that you cannot have your ALS truck staffed. That means 2 people on it waiting for a call for every license you have. If 1 minute of one day you don't do that, you are obligated to report to the state, and they will not let you report too many times and you won't do it for a living. A BLS agency is not held to that standard. We've seen them miss 50% of their calls. It's just a different level. But for the ALS ones, they must be 100%. In my time here, about 10 years, Benzie EMS, never once have we not met our requirement of having a truck available. We may run out of trucks if they go on calls, but that's not the same as just not having one. So Elmira Township is a little different. They're BLS only, transporting fire. They run about 384 calls a year. Central dispatch numbers. Again, source for the millage collected was the county at just under $500,000, giving them a call cost of $11.80. What I don't know for them, for instance, do they get any additional money from their general fund? They might, I don't know. But I just took the numbers that I had and I thought it would give you a little comparison, a snapshot of where we're at. And unless you have any questions, that's all I have.
I have one.
Go ahead.
But you based it strictly on the millage collect,
Yes, sir.
not on any of the insurance claims or any of that.
Correct.
That is going to be added later.
Yes.
Okay, so that doesn't, to me, it doesn't give me a full perspective of what's going on here.
The difference is everyone bills insurance. Every agency does. The skill of your agency to effectively bill your insurance and collect is a factor. I can tell you when we had Northlight Billing do our billing, we were the highest billing ratio collection that they'd ever seen. Some of that is simply because we have long transport times. Long transport times means we have to do a lot of services. A lot of services means a lot of billing. So that gave us a great ratio. I don't know what those other places do, but everyone does. Every service bills for service, it's, reduction in cost. So I can't compare those from the other areas. These numbers were completely objective. They were just what they were. So you're right, Gary, that would be a little better picture. We can tell you what our collection rates are and so forth. We do what we can. The system was designed that the millage sort of provides the service, and then we bill for service for those who use it. And this is one reason our millage is 0.9 instead of 3, because we rely on both of those. The ratio used to be about 50-50. I think we're 60-40 millage versus recovery now, but that's true.
Because some of it's Medicare.
You're right,
That's
and
where
that pays.
I mean, I deal with Thompsonville's all the time, but I just want the public to know this is not the only funding you have.
Right.
And that's kind of where I'm coming from, so appreciate it.
Like I say, in this equation, that's considered cost recovery. It's literally what it's called on the fire department side of it, because it's a reduction in a cost spent to provide a service. It's what it is. And Benzie County does have, in comparison to Green Lake and Long Lake, they have a nice advantage. There's lots of lake there. Those people have good insurance. The insurance companies, unfortunately, they pay a lot more for services. Medicare and Medicaid, they don't pay that much, and you can't counter bill. You have to accept what they provide. So that, fortunately, we're large enough that with our volume, maybe our efficiencies can help chase that back, but that's something that's harder for us.
Thank you.
You're welcome.
The questions?
Yeah. Can you share what occurred a year ago that made it difficult for us to get students from Great Lakes?
My understanding is we re-looked at that clinical contract a little more carefully, which was probably due diligence, and realized that it didn't provide as many protections for the county as maybe it should. And we've been working with them to make some modifications. And I know that Katie has done a lot of work because I'm really good at badgering. And no one likes that, but it's important for us and really trying to work that out. We have a couple scenarios we're trying to put together, but the cooperation level, not from our side of it, from theirs, is not deemed ideal response at this point.
So Benzie County had an agreement in place that was very one-sided and provided by MMR. And so, and it had never been reviewed by legal counsel that we could find. So I sent it to legal counsel's due diligence to protect the liability of Benzie County. Our legal counsel offered some changes. MMR said, nope. And so I worked with legal counsel to soften some of the language and maybe tweak it so that it was a little more in MMR's favor, but still protecting the county. So far they're, saying, nope, take our contract or leave it. So we are working through seeing if there's maybe some potential waivers that we can put in place for the students that would take some of the liability off the county. And then also working with some of the higher ups at MMR as well to see if there's any room to negotiate, not such a one-sided contract.
Not to demonize that process, the classroom setting, I'm literally had to hire in as a employee of MMR to teach in that class. And they did that, and they like the instructors there. They like having us because the students like coming here. We were the number one. They couldn't let all the students ride on all the days they wanted to, because we really work hard for those students, and they're hard. They're extra work. We don't get any more money for this. There's lots of complaining that happens when you have to do extra work for no money, even though we all were in that process. So the class itself, the instructor, Jake and Mike, and they're very receptive to us, very helpful. It's just this legal nonsense that or necessary evil that we're working with.
So you have 2 other contracts in place right now that the agencies have agreed to from Cole Stoker. So, we're utilizing those at this point. We're trying to work with MMR, saying to them that it doesn't have to be the same contract, but, can we work on these tweaks? So we're still working on that. We're hopeful that we'll make some traction. Obviously, this board could say they don't accept the advice of legal counsel as far as the contract drafted and could happily sign the one-sided contract provided by MMR. The board has the right to do that. I just recommend that that's not necessarily the best move, because when something happens, we're not protected as a county in a lot of ways.
Appreciate that. Thank you. And then a little bit of the data that you presented there, Elmira Township. So these are folks that are not only paying the county millage for EMS services, they're paying a local millage as well. Are you going to develop the numbers a little bit more? I mean, this is a great baseline to start on, but I'd be interested to take this a couple steps further. Like Gary was talking about the different sorts of funding and what different people and different entities are actually paying, what the best model looks like. I really appreciate the direction you're going with this. I had never seen data like that before.
Maybe I can get with you afterwards and you can help me decide what to look for. We'll do our best. Fortunately, we have a little extra access with looking at Green Lakes. Obviously places are a little bit careful with the data, and I want to make sure it's depicted accurately and fairly, but we have a little bit of an in with Green Lake and Long Lake. Elmira, what we have there is just the other numbers, but we could ask about that. It is a unique system. What Elmira does, and I shouldn't speak for them, but basically they have to run a fire. How I've said 80% of the fire department calls are EMS. I've been in the fire service for a long time also. The way it has worked is the number of fires has dramatically reduced over the years. And frankly, to make a service that has all the tools it needs, they work well to do rescue. And then they transitioned into transport as well, so that you can have really qualified staff that can do multiple things and you can sort of run together and it's efficient. So Elmira does pay a fire and EMS millage, which is not, I believe it's a total of about 2.2 mils. And with that money, they provide fire rescue, fire, and also BLS transporting service as well. So those residents do get something from that. It is a little bit of an overlap, that's true, but they're also getting that fire service as well. And I don't know how much additional money they would, really would have to pay out for that.
Thank you.
That fairly.
Chris, very effective conversation and presentation. We may call you back in a minute, but I want to move on to some other others, okay?
Okay, super. Thank you.
All right, thank you. Is there anybody else that wants to make a presentation to the board? Dan?
Good morning. So, a little bit earlier, I handed
Dan,
out.
for the benefit of those on remote.
Oh, yeah, I'm sorry. I didn't introduce myself. My name is Dan Thrall. I'm the health officer for the Benzie Leonard District Health Department. I handed out the 2024 annual report, and I'm not gonna, in the interest of time, I know we're lots of presenters and whatnot this morning. There's a lot on the agenda. I'm just gonna touch on some highlights. The report itself, highlighted some staff recognition. I just want to say that, you know, we have exceptional, excellent staff at the health department. We had our state accreditation review this year and we passed with flying colors, and more than once I was told by our reviewers that, you know, they asked if they could take processes and policies back that we developed, you know, to share with others in the state. So just really, really proud of that, and really proud of our staff. Just touching base on some current events, I guess, in our personal health department, measles has been in the news quite a bit. There's a pretty large outbreak in Texas, and then there's other smaller outbreaks throughout the country. We're at about, I think, 800 cases as of, you know, last week. It's probably increased. And just kind of wanted to bring that down to, you know, what does that mean for Benzie County? You know, looking at our school age kids, our coverage rate for MMR, which is the measles, mumps, rubella vaccine, is about 83%. Ideally, you want to be at about 95%. That number has gone down, you know, over time, over probably the last 10 years, the 83%. It does mean that we are vulnerable, if we had a situation here. And I just want to let you know that we've, you know, been communicating with school leadership, both here and in Leelanau County, about exactly what that means and how we would work through something like that. We've also put a lot of information out to the media. And we had a couple of clinics that were targeted for, you know, catching up with the MMR vaccine. Unfortunately, they were not well attended, but that's where we're at right now. Just touching on a few numbers, you know, that are also, you know, there's lots of numbers in the report. I'm only going to talk about a couple of them just for your interest. In Benzie County, we have 104 licensed food establishments, in case you didn't know. We have 21 food trucks that are licensed. In our environmental health programs, the comparison between 2024 and 2023, we're down about 6% in septic and well permits, which is not a huge variation. And right now, I can tell you that our numbers are very still robust. We're getting very busy in our environmental health program. Our evaluations for existing systems are through our time of transfer program are up about 10% from 23 to 24. And our unsatisfactory rate for septic systems was right around 4%. Now, in comparison, Leelanau County just started an evaluation program back in 2023. They're at about 16% with unsatisfactory evaluations. So what does that mean? It means that's a brand new program. We're out there looking with properties that are transferring, and lots of things are being found that were never looked at before. Now, because Benzie County has been doing this since 1992, it is that rate of, you know, 4% has been steady for many years, right? And sometimes dips down into, you know, 3 or 2%. So I guess that what I'm saying is that it's you know, it's doing its job in making sure that things are addressed. So with that, I'll also share that, you know, I'm in communication with Senator Singh, who is, you know, in Lansing. He's a senator that encompasses the Lansing area and, you know, out from there a little bit. He is one of the ones that spearheaded the statewide septic code bills that were in the legislature last session. He is planning on reintroducing the bill that was basically ended in December with nothing being done. He's reintroducing that. Essentially, you know, from what I'm gathering, essentially where we left off. So there, I think, still would need to be some significant tweaks to that. But you know, we're talking. He's, you know, I have to commend him. He's not just ramrodding through and doing, you know, what he wants. He's, you know, reaching out to us and getting our feedback. So I'm glad about that. I don't know if the bill is going to go anywhere, being that it's, it's a Senate bill. It may go somewhere in the Senate, but once you get to the House, I don't know that there's support there. I was in Lansing a couple of weeks ago and talked to John Roth, and he did not think it would go anywhere in the House, but we'll see. Oh, one other thing I want to talk about with evaluations with Benzie County is our turnaround time. You might be interested in this, is 10 days from start to finish. So I think that's really good. It's essentially 2 weeks. And there's a lot of variables in there. We rely on realtors mostly to come in and apply in a timely manner and whatnot. But it just means that we're getting out there, we're getting the job done. And from the time that they apply to the time that the report is generated, is 2 weeks. And, there's a lot of variables in there, like calling MISTIG, getting water samples, taken and to the lab and getting results and maybe resamples. So I think that's a really good number. And we really do not receive any complaints from realtors for the most part. I mean, there's always someone that complains, but let's see. I just want to talk a little bit about financials. In 2024, our audit resulted in a unmodified opinion with no findings. And that was, Dodie Putney was our longtime finance director, and that was her goal is to come out on a good note. And she was able to do that. So happy about that. We did in 2024 with a surplus, which we are investing in our Benzie County Resource Center building. We have a renovation project going on right now. So most of that is covered by a public health infrastructure grant. But there is a small part that is coming from our fund balance. As always, we appreciate your continued support through local appropriations. Even though the local appropriations are a small percentage of our budget, about 8 or 9%, those local dollars are flexible. Most of our funding is pretty siloed. We can only use it in those specific programs. But local dollars, we can move around and fill gaps where it's needed. And we can also use it for Medicaid match and cost-based reimbursement. And those are Medicaid matchable programs. Now, with that being said, that is something that we're concerned about on the national level. There's, Medicaid, there may be some changes coming down the pike on that with a budget that is going to be proposed soon. And that's one of the areas that we're concerned about is the matching funds that we normally get. I mean, it's a unique funding mechanism for local health departments. And if that goes away, that could be, I think last year in 2024, we matched about $320,000, which means that we got $320,000 back. So it's a significant amount and it helps our overall operation. Let's see, it was about 2 weeks ago, I was here and just gave a brief update about cuts that were happening to Health and Human Services and how that affected local health departments and our local health department specifically. At that time, I reported it was going to be about $80,000. Well, just a few hours later that afternoon, we found out it was going to be more like $300,000. So this is the world we're living in right now, where we're getting, notice about things very quickly and abruptly, and things are just, I think we got a notice on a Monday or a Tuesday. That was a Tuesday actually, and the funding was done right that day. So I'm happy to say that we were able to whittle that down a bit to about $230,000, just with getting our financial status reports in and aligning that with, what our budget said. So with that, I think for the rest of this fiscal year, we're looking like we can manage with, moving staff around, not filling vacant positions. And we also have one person that's retiring a little bit early that we're not going to fill. We are able to cover that for this fiscal year. What I'm worried about is really next year, because, overall for that entire year, it's more like 590,000. So, and if, depending on what happens with Medicaid, I mean, there could be some significant staff changes we have to make. So.
And how about if we open it up to questions?
Sure. Yep.
Any comments or questions for Dan? Gary?
The cuts were, I got it correct, strictly through personal health,
That is correct.
all community connections and some of those things. So
Right.
it wasn't targeted at everything. It was just targeted at that one area, I guess, is how I'm trying to say this. So can you explain to people what the personal health and
Right, right. So I guess to explain that, at our health department, we're a small rural health department, and our staff, we are funded through many different buckets of funding, so to speak. We have integrated services. We don't have one nurse that specializes in one area, right? So everybody's got, maybe 0.2 or 0.15 or a little bit of time coming from this pot of funding and a little bit of time coming from this other pot of funding. They do multiple things, right? So the particular funding that was cut was called infection prevention, which was, essentially what it is. It went into work that had to do with communicable diseases and preventing them. And it could be anywhere from immunizations to outreach materials on how to, deal with respiratory illnesses and whatnot. The other was for health resource advocates, which was called in Michigan My Healthy Schools, or My Safe Schools. I'm sorry, My Safer Schools. In both of these funding mechanisms started when COVID started. And it was more or less, if you think about it, our infrastructure was lacking. We were understaffed to deal with something that big. And these were meant to kind of bolster that, get us up to speed. And it did, and it worked. And that was, planning on to carry through fiscal year 2026. So we knew that, it was going to end, but there was work being done to try to, maintain that funding, just with the recognition that it helps support public health infrastructure, right, and staffing. The My Safer Schools one, it essentially paid for school nursing time. We do have another program called the SWP program, School Wellness Program, which is a totally separate, different pot of funding from the state and a different model. Whereas a school nurse and a mental health therapist, where we have that at Benzie Central Schools, for instance, and Frankfurt here in Benzie County, where this funding, the My Safer Schools funding, helped us support school nursing at Betsy Valley, is one of the schools, like the elementary schools. So that's kind of the shortfall we're looking at. That's what's being affected. I don't know if that answers your question
yeah,
totally.
it helps. I just wanted to explain it wasn't everything you do. So
No, not everything. No. And like I said, we spread, our staff, they're funded through many different pots because they're doing many different programs. So.
Other questions for Dan? Appreciate the presentation and you being here today.
Thank you.
I do have a
Appreciate-
quick one. Is this going to be is this in digital form? Will this be able to be put on our website if I tell people where to find it?
Yes, it's actually on our website. The annual report is
Right.
under publications. So yes,
Okay.
I can send you, if it's easier, I can just send you the link, or I could send Katie the link.
Yeah, that'd be great.
Okay.
Also, right on the homepage of our website, under the tab Government and Community, there is direct links to the health department too.
Perfect. Thank you.
Thanks.
Very good.
All right.
Thanks
Appreciate
again, Dan. Other reports from agencies or departments? Then before we move into new business, Chris, I'm going to ask you to step back up to the podium again. We have a couple of extra minutes. I wonder if you would, for the benefit of the public, explain a couple of things, and I'm just going to give you each question one at a time. What's the difference between getting a call to transfer a patient versus from the hospital versus it having a higher level of urgency? Can you define that for us?
So Benzie EMS, we service, not via contract specifically, but we service Paul Oliver Hospital. They are a critical access hospital. They can't really admit people. They can help stabilize. They can deal with some things, but oftentimes they need to transfer patients to a higher level of care. I'm going to say 85% of the time that's Munson Traverse City. So once in a while it's Manistee. Sometimes it's also Cadillac, and we define those at Benzie EMS as local transfers. And we will take a local, non-emergent transfer as long as we have 2 trucks in the county. If we only have 1, we'll have that patient wait until we get 2 trucks back in the county, and then we'll take them. They are in a hospital. They're being treated. We take those, and that's, frankly, it's lucrative. It pays pretty well. We get pretty good money to transfer those patients. And even though it's not emergency medical service, in my opinion, and that of a definition of the state, it helps us be efficient. It makes us busy. Some of our mutual aid partners actually resent it when we're out on transfers and maybe they have to come help us. One of the reasons we only do it when we have 2 trucks. We will only do outside of the area transfer if we have 3 full trucks, which we try to have 3 full trucks a lot of the time during the day. It's hit and miss. We do our very best based on staffing ability. So we will decline a transfer out of the area if we don't have 3 full trucks for the duration, and we will only take those. They pay pretty well and they help us be efficient. They also help many of our residents. Ironically, the transfer ratio, most of the transfers are not Benzie County residents. Little interesting tidbit, because I do QA and I'm a numbers nerd. I look through that and I'm like, holy smokes, another one from Manistee, Leelanau, Cadillac, what is this? But anyway, but nonetheless, it's a good service and it helps us be more efficient. It gets you a little more bang for your buck, and there is a little bit of a cost to us when we take a truck and have it do something else that's not available, but it is efficient. So most transfers are ALS. Some are BLS. So sometimes if we're really busy, we'll see if one of our BLS partners, that would be Thompsonville EMS or Elmira EMS, is willing to take one of those just so we can take care of those people. And of course, they get paid to do it as well. So you have ALS and BLS transfers, emergent and non-emergent. Every once in a while, there's an emergent one. That is someone, ideally, I mean, as long as the system works correctly and the hospital calls it the way they're supposed to, they're there for a stroke, they're there for a heart attack, they're there for a trauma, they're there for something emergent that time matters, that they need to get to the trauma center in Traverse City. Traverse City is really the only place that an emergent transfer should ever go. That person is so unstable, they are literally going to have a significant likelihood of an unfavorable outcome if they're not moved fast. Then we will take that call, even if we only have 1 truck in the county. We will come get it and we'll get it out of there. And we want to do that. Does that, that's a lot of talk. Art, did that answer your question, sir?
I think that helps.
Okay.
And I realize there's exceptions to everything, but because you are the numbers nerd, I bet you have a good idea of what the average response time is from the time you get that call to the time you arrive on site.
For a transfer or for a 911?
Let's just call the 911 right now.
Okay. We kind of call those shoot times, and there's a couple numbers we look at. The number that we want to concentrate on most is what Tom calls shoot time, which is the time of dispatch to the time the truck is en route. That we have a lot of control over that. Okay, so a call goes out and they start the timer as soon as the call gets dispatched. So they got to tell everybody where they're going. Everybody's got to check in. And that number, I mean, you're talking about a few minutes. And what the crew has to realize, okay, that's us. They got to figure out which crew has to go. They have to think a little, they got to go to the bathroom. Okay. We got to get out to the truck. We got to start it out. And the second thing, when I started, sometimes the kids would jump, the younger people would jump into the fire engine and scream NASCAR. This is not the environment. We want a professional, expeditious response. We do not want screaming NASCAR, not the right method, but if it's a cardiac arrest or a choking 1-year-old, as we had Saturday, yeah, that was pretty quick to the truck. So you're looking at a 3-minute time as our goal. Sometimes we go up and down from that. Sometimes it takes a little while to check in because other units are checking in, which screws up our numbers. And sometimes when we look at averages, we're not really in a super big hurry for a transfer. If you're finishing your sandwich, you might check in for that maybe 6 to 8 minutes afterwards. If it's not an emergent transfer, it doesn't really make a huge amount of difference. So 3 minutes is really the number we look for. We kind of chase after that periodically. Tom mentions it, says, hey, I don't know what's happening, but our shoot times are starting to look poorly, but they're normally very good. The on-scene time, well, that one is more tricky. We can do better for you on that data, but it depends where the truck is and where they got to get to. If you're in Frankfurt, and we all know this, we have 2 stations. When we're perfectly staffed, they're in a pretty good spot. Frankfurt's not perfect, but it's not too bad. Station 2 is really quite good. But if the Frankfurt truck has to come all the way across, it can take a little longer. So those times do vary. But I think our longest response time, you're talking in the 20-something minutes, which, don't get me wrong, that's a long time. But if you've got to come through traffic and varying degrees of how cooperative other drivers are, and we don't want to cause an accident, it can take a while. And if you get, down some windy roads, it takes a bit.
But you're in the bus within 3 minutes of the call.
We should be.
And you're right. I mean, the location has everything to do with when you actually get there. Let's go back to transfers just for a moment. I'm going to guess most of those are initiated by the hospital, Paul Oliver.
100%.
And who makes the decision whether it's urgent or you call it non-emergency versus emergency? Who makes that decision?
Well, the state of Michigan after COVID announced that there was no such thing as emergent transfer because they're already in a healthcare facility. That is not a call for emergency medical service. We can agree or disagree on that, but that's what the ones that make the rules say. We've allowed the hospital, the doctor there, which is maybe not a doctor, but PA or nurse practitioner, the ability to call that. And look, most of those we want to do that way. If you are having an actual heart attack and that can be diagnosed with troponin level or electronic EKG, you need to get to definitive care. And every minute literally does make a difference to the amount of cardiac muscle that will die and not come back forever is there. And the same with a stroke. There's some things we can do for a stroke at a stroke center, which Traverse City is mostly a stroke center, that they absolutely cannot do anything like that for at Paul Oliver. So there's some, so most of the time they're pretty good. Every once in a while we feel as though we are gamed and we complain and talk about that. And even medical control with Dr. Smith has helped us with that. But they're pretty reasonable about it. If it's an emergency, they'll call it an emergency. Every once in a while we'll hear one and we're like, we're going to go get that. So there is no specific criteria other than the state says there's no such thing. You're in a medical care facility.
Okay. All right, I appreciate that. So I took advantage of bringing Chris back up. Does anybody have additional questions? All right, thanks for answering those
Okay.
questions.
You guys have a good day. Thank you for your time.
Thanks, Chris.
One more chance. Any other departments or agencies that'd like to speak? Yeah.
I'm trying to miss it again, Art.
Kelly Long, County Treasurer. Presentation of the bills, April 3rd through April 10th of 2025. We have $587,484.47.
I'd entertain a motion to approve the bills.
I make that motion, Mr. Chairman.
Thank you, Bob. Support?
I'll support.
Thank you, Gary. Questions, comments? Hearing none. I believe that's roll call.
Markey,
Yes.
Nye,
Yes.
Roloffs.
Yes.
Sauer,
Yes.
Trigg,
Yes.
Janat,
Yes.
motion carried.
Anything else?
Yes, I thought I'd do a quick update on Land Bank and what we're doing. I don't think we've talked for a few months.
Great.
Right now we have 4 properties in our inventory. We have our special 669 property that we'll probably have forever. We have 2 small properties on Judson Avenue, and then we have what we call the 7440 River Street property. We just took bids for that property 2 weeks ago. We're hoping to award that bid this Wednesday, 9 o'clock. We have a land bank meeting for that one. And I just received a bid for the Judson property as well. So we're getting down there. 1 property left. And of course, I'm not foreclosing on anything. So the land bank is looking to redefine itself, maybe bring in an heirs program, maybe bring in something like the Northwest Housing is doing program with helping with new roofs and maybe handicapped porches, things like that. We're also have been asked by the state land bank to help be a supportive member for the Alberta project that is going to be started up here soon. So we'll be attending meetings and helping the state land bank with whatever they need done out for that big project coming up. So that's basically where we're at the moment with our land bank.
Very good. Any other things, Kelly?
Nope, that's all I had. We're busy collecting delinquent taxes in our office. Otherwise, that's about it.
Well, I can tell you that the land bank is an important function for economic development in our community. And hopefully we can have more opportunities. Are there any questions for Kelly before we let her step away from the podium? All right, thank you much.
Yep.
We have a 10:30 presentation. It's 10:20 now. Would the commissioners like to take a short break?
We would.
All right, let's reconvene then at just a little bit before 10:30.
All right, everybody, you're unmuted.
Good, we're back in session. Would you like to introduce the next subject, Katie?
Yeah, absolutely. So we have Corey Ellis here, who is the dispatch director, and he would like to announce to the Board of Commissioners the Dispatcher of the Year Award. This is something that Corey started when he started here in Benzie County. It's a pretty cool presentation that he does, and so I'll let him take it away.
Cool, thank you. Good morning, everybody. Corey Ellis, 911 Director here in Benzie County. I'll just read you a little bit of background and we'll quickly find out why this person is here. You may or may not know why they're here, but good morning, everyone. It's always a pleasure to take a moment to celebrate the incredible individuals who make our team and our community stronger every day. Today, I'm honored to recognize somebody who truly embodies the spirit of excellence, teamwork, and community. This is our very own emergency communication specialist, Janet Engler. Janet has consistently gone above and beyond in everything she does. Her work performance is nothing short of exemplary, meticulous, reliable, and always delivered with a high level of professionalism. What really sets Janet apart is her unwavering willingness to help. No matter how busy she is, she always finds the time to support her teammates. She brings a spirit of teamwork and collaboration that makes the workplace better for everyone. Janet has also stepped up time and time again to take on special projects or special teams, such as public education, attending community events, tactical dispatch, and being a communications training officer. Janet is also our undesignated or kind of designated decoration master. She does an amazing job of making our workplace feel more like a home away from home than a workplace. You've seen some of her work in some of the pictures, some of the different events that take place. She has a hand in all of that. Janet, your hard work and commitment do not go unnoticed. You are a role model and an integral part of this team. On behalf of all of us, thank you for everything that you do. And if you would please stand up, I would like to present you your award.
You want to give a presentation,
I don't think
Jim?
I'll give a speech. So thank you all for allowing me to be here and to make that presentation, and that's all I have.
Thank you.
Thank you.
Corey, we appreciate you doing these kind of recognition, you know, and we need high efficiency out of our employees, but our employees need us to acknowledge when we get that level of efficiency.
Absolutely.
So good job. And is Janet right?
Yes.
Janet, great recognition today for you. All right. Just one more whack at the department heads or agencies that want to speak. That was quite the expression, wasn't it?
They had their time.
All right. I'll work on my presentations. Why don't we move into new business, and Katie, can I turn it to you?
Yes, so the first item on your agenda is an amended operational policy for financial hardship. This policy was originally approved by the Board of Commissioners about a year ago in its new format, but it's also been in place in Benzie County for quite some time, probably over a decade. This policy directly affects the treasurer's office in working with the homeowners in our county to ensure they're able to stay in their homes and not be foreclosed upon. Kelly Long is here if there's specific questions related to the policy. You'll notice what's in the policy in blue is what's being added. Everything else is part of the existing policy that was there. Commissioner Trigg offered maybe some tweaks to the language. So Kelly is going to come up and answer that question for you.
Yeah, so I just had a couple. The one is that on here it says the purpose of this policy is designed to delay foreclosure deadlines by 1 year for owners who are actively working to catch up on their delinquent property taxes pursuant to the statute, blah, blah, blah. And it looks like the blue is just tacked on at the end under the purpose. And I was just suggesting that the blue should probably be moved up because actively working to catch up on their delinquent property taxes and are participating in an established payment plan for financially distressed people pursuant to statute MCL 1178.
Right, it's a different MCL 211. So I noticed that wasn't added in there for some reason. So I need to get the new MCL number added to that second half.
Oh,
So it's
so
two
there's-
separate things.
There are two.
That's why I'm adjusting
Good.
this policy, because I went to a new treasurer's training and found out more about lovely things in our statute and how we could help financially distressed people. And so it's a new MLC that got left out. So we'll have to get that added in there. I think it's still under 21178, but it's a specific like Q or T or something. I can't remember the number off the top of my head at the moment.
Okay. My other thought too is that, under definitions, it talks about PRE status.
Mhm.
And then, but down in the next section under requirements, it says primary residential exemptions. And I was just thinking that it might make more sense to define that up under,
We could make
Maybe
that
so see
say
it.
primary residential exemption status.
Yeah, we can adjust that.
and so then I think I read this then, so as far as content,
Hmm?
I think I read this that the second blue part under the purpose
Mhm.
was basically further defining the actively working to catch up on their delinquent property taxes. And so I wasn't sure this established payment plan, because then in requirements section E, it talks about present a plan for payment. And so I guess I'm wondering, is an established payment plan something that maybe your office helps with? Or is that again something that the payee is coming up with?
It's kind of both. We help them
Okay.
establish some sort of payment plan that's within reason so they can get caught up in a 12-year time frame. Now, the C is for financially distressed persons. These are persons that fall under are in major problems. They fall under poverty exemption, very low, and so this might be actually a 2 or 3 year program by the time we're done. Normally, a hardship is a 1-year program, period. You have 1 year to get yourself caught up, and that means you have to get 2 years caught up. With this statute that's in there under this financially distressed persons program, we can set up a payment plan that hopefully will get them caught up in 2 years. But if they're really hard off and say, no, I can't, there's just no way, then maybe it's going to take us an extra year. So what I am proposing here is we sign this agreement that I have and we set up a payment plan. And as long as they're making those payments every month, that's guaranteeing them that I will not foreclose on them a year from now. That's what this new statute has been telling me that we can do going forward
Well, that sounds great.
and help out more people out there that really need some. And I think I've had 2 people this year that fell under that. So we set up a payment plan. And right now, I think the payment plan will get them caught up in 2 years or in a year. Get that 2 years caught up in a year. So hopefully they'll follow the plan. And I basically it's like you follow the plan, you make those payments, you can't miss a payment. You miss a payment, then I can't guarantee that we won't foreclose on you. That's basically what that's about.
Thank you. That was very
Yeah.
helpful.
Yeah, no problem.
Can I ask a question? If they're fell behind,
Mhm.
interest and penalties, can that be waived?
We can work on it and discuss it, make it,
But
I mean,
some of
right
these
now with
things-
statute, it's 1% a month and 1.5%, but it's not compounded, obviously. And it's not, so it's based on your base tax. So as long as they're making the payments, that interest, it's really just interest. That interest will be less each month. So as long as they're making their payments, we're applying it to base and interest and penalties.
Just want to make it easier for folks to catch up.
Right.
That's all I'm
Right.
looking at.
And that's why we set up the payment
Yeah.
plan, because the
Yeah.
more they pay, the less interest they're going to pay.
Right.
Gary, if I could comment on that though, that is not a local decision.
That's not a little.
No, on
No,
on
it's-
interest and fees,
It's
you have to
statutory.
negotiate with the state on it.
Just asking.
But I really appreciate that we're working to try to keep people in their homes, because we all know once people are out of their homes, it's harder to get them back into a home.
Yeah.
So this is
Agreed.
great. I appreciate
I know all treasurers of the state are pushing towards this solution and trying to keep people in their homes and having less and less foreclosures happen.
Mhm.
It's a hardship for them. It's a lot of work for us. We don't want to have to sell somebody's home but we have to follow the statute, and we've redone the statute. So it's better. So in case they do lose their home, they can file the necessary paperwork to get those proceeds. But we're hoping that doesn't occur going forward.
I think it's misinformation over the years that suggested government wants to foreclose on properties. That's the last thing you want.
Correct.
We'd rather have an active taxpayer on the tax rolls than we are recovering properties.
Exactly.
I'll have another question for you, but I'm going to take our question up before we.
I'll make the motion that the Board of Commissioners approves the 1-year financial hardship deferral from foreclosure policy dated April 17th, 2025, and rescinds all previously adopted policies.
Thank you, Gary. Is there support, please?
Marky will support.
Any additional comments or questions for Kelly?
Yes, I do have a concern, and I would like to see this policy amended to have it be contingent on the property not having been deemed in any sort of blighted state. Our smaller entities go to great lengths. Our villages, townships, and our city go to great lengths. And often it's a very long process to really address blight situations. And my concern, although I'm very supportive of this concept, is that this mechanism be used to lengthen the clock. And so it would be my ask that we amend the motion and add a contingency that there are no blight, that the property has not been deemed blighted, or there are no blight actions being taken involving the property when the forbearance is granted. And I'm open to discussion on it, but I know a lot of, especially I talked with my township about this suggestion, and they said they would be very appreciative of it.
I'm not sure the statute allows for those sorts of conditions.
But it's our policy.
But this policy is based on what the statute allows for this program. I'm not sure, because the statute defines we're allowed to have a policy to do as such. I'm not sure if the policy allows us to then add strings to that. So we'd have to ask legal counsel if we're even able to do that. I just don't know.
And then, right, there's also another aspect to this. The blight issues, isn't that a township, a village, or a city issue? It's
Correct.
kind of hard.
We don't have an active ordinance at the
Right.
county level.
And then we would have to
Right,
then
but we-
rely on if every single entity then has a blight, and then it's them determining whether, I think it's a great idea. I see a challenge coordinating with the local entities trying to use their.
Yeah, I don't see that challenge. I think that we have prided ourselves on being cooperative with our lower local entities. And I think it's a responsibility. I don't think it would be that cumbersome to have a forbearance issue be presented and reach out to the township that they're in and say, is this property in any sort of, I have concerns just based on the things that my township has endured trying to address this kind of thing. And I would like to know if it's an option.
So just to chime in on this, I think I know where you're going with this. It gives more teeth to some of our zoning enforcements, which is blight would be one of them. What I'm hearing is this may not be the right place to do that. But would it make sense to act on this policy with the understanding that we want to look for something that gives us more leverage to prevent blight from happening or cleaning it up? Just
No,
we're not sure.
I think that responsibility falls on the smaller entities, and I think they try very hard to accomplish that. But a lot of the blight issues turn into litigation where they're in court cases and things like that. And I know that
Now,
if
cannot those issues be put a lien on the property to pay or to, because basically you gotta go really against that taxpayer, that owner. Now, I know in the past we've had out in Inland Township, they did something similar to getting a cleanup done They paid for it with the owner's permission and put a lien against that property, and it went on the tax bill, and the owner paid for it.
Yeah.
I mean,
And
there's
think that
those
goes to
options.
different entities, resources and
Mhm.
staffing and how much they have to.
Right.
Focus on the blight issue, that
Right.
kind of thing. I just want to make sure we're not extending a time clock where an issue that's trying to be handled, where we tie the hands of our local entities. We have Mayor of Frankfurt here. Is this anything you want to speak to? If you don't mind, Chair.
Two separate issues, and speaking of blight, last night we had a public hearing on one of our, and it is a very lengthy legal process that you have to go through. And this is one of 3 that we need to address. I think this program, I think it's up to every community, city, township, to handle the blight issue. I think that's separate from this policy. That's
Okay.
just my opinion. And I agree with Art. Each community needs to put something out there concerning the blight. And it's a nasty and a long process. And
Yes,
the-
it is. And there has recently been one that was about to be foreclosed on in Benza, and all of a sudden, they pay up and the time clock, that what you think is going to be handled and an opportunity to see the property cleaned up is not there any longer. And the effort's not being made. So I do see them married a little bit more, but I do understand the reason to do this, and not every candidate is in that situation. If there was an opportunity to address this while we were making this policy, I would have liked to see that done, but I appreciate your
and
input.
the
I'd like to call for the
individual that we
vote.
had The hearing on last night, that's exactly what we're going to need to do. If it doesn't comply what set forward last night, will be a lien. The city will clean it up and put the lien on the property. And he's very aware of that's what's gonna happen. So it's a messy process, but it has to.
Folks, we've had a commissioner call for the vote. It's not, I don't want to dismiss this conversation, but
I think it's a separate issue. Go from there.
if we're ready, roll call, please.
Aye.
Yes.
Roloffs,
Yes.
Sauer,
Yes.
Craig,
Yes.
you're not,
Yes.
Markey,
Yes.
motion carried.
Kelly, I'll come back to you later, on my question, okay?
All righty.
The next item on your agenda is declaring a service weapon surplus. This is a transaction that we've done a couple of times in the past and is quite customary in the law enforcement world. When a deputy or a police officer retires, their duty weapon is retired with them and given to them. In this situation, the union has asked to purchase the weapon to then gift it to retired Deputy Marty Makowski.
I'll make the motion that the Board of Commissioners declare a 6-hour 40 caliber service weapon surplus and authorizes its sale and disposal, with the sale proceeds to be utilized for replacement service weapons.
I'll support for discussion.
It's open to discussion.
What constitutes retirement and or separation at what point in time? What's the longevity of an employee before that weapon is not supported or not sponsored by the county?
It can only be recommended by myself. Historically, it's been 20 years. That's kind of been our benchmark.
There's nothing on paper, correct?
No.
Right.
Well, this is, I guess the decision is yours as far as the surplus. The payments coming from the union, and I'm in the middle.
I just wanted it on paper. Sure.
Yes, sir.
Let me ask the question differently. For purposes of the union, as an example, is there a definition of retirement? 20 years plus age?
I've encouraged them to put it in their bylaws, but I don't think they have,
Okay, all right, so there's no definition.
not to my knowledge.
All right. Christie, did you have any questions?
I did. I submitted a question. So one thing that I thought would be helpful in this process would be having a policy that said that, you know, this is what we do, right? These are the avenues we can take, right, with retirement or whatever. And I've seen, I did some research. I saw that, yes, this is typical, but there is also those policies in place. And so again, I'm not going to withhold my vote or anything for a policy, but I'm just suggesting that we should probably have a policy in place. And likely a procedure as well. And a procedure is, so the policy tells you this is what we do, and the procedure is, this is how we do it. Anyway, so something like this, to me, would make sense.
Sure. The other thing we have to be careful of is, if the union doesn't support it or won't pay for it, then it's gonna have to be us or
Yeah,
someone else.
which we can't do.
If it's a policy, then we have to be careful of that.
Hmm.
Making it a blanket.
It seems to me that there is some definition of retirement. If you're not eligible to collect your retirement benefits at any given time, doesn't that in itself define retirement?
I would presume that, but 10 years is, you're being vested, so you can collect. If you've met all the other requirements, if you get 10 years in, then you can retire.
And begin collecting your retirement
Yes.
benefits?
If you've met all other
If you-
avenues of that
Yeah,
plan.
so that,
Well, that's the
there's so many
definition.
variables.
So-
I mean, that's the definition.
Within our collective bargaining agreements, we were able to add in a statement that, yes, if you meet the MERS eligibility for retirement, then you're considered retired, specifically regarding the healthcare that we offer. And so that's what we put in the union contracts. It's just a simple statement of if you meet the MERS eligibility requirements.
Yeah. So really, there's somewhere it's spoken to. It's not just arbitrary. I mean, and the other piece of this is, well, if the union says, nope, not going to pay for it, I mean, there's the other trigger. So,
That has happened in the past, so.
So it could be a if this and this, then this.
All right. I didn't want people to think it's as arbitrary as it sounded for a moment. It's not. Any other questions or comments?
I just wanted it on paper.
All right, we need a roll call on this?
Roloffs?
Yes.
Sauer?
Yes.
Trigg?
Yes.
Janat?
Yes.
Markey?
Yes.
Nye?
Yes.
Motion carried.
The next item on your agenda is an item you've seen annually for the past few years, and this is regarding summer road patrol contracts that the sheriff's office participates in. I will note, I do have a typo in my motion. It should be 25, not 24 summer months. But if you have specific questions regarding the agreements, the sheriff will be happy to answer.
There's not an entertaining motion.
I'll make the motion that the Board of Commissioners approves the sheriff's patrol agreements with the Village of Beulah, Crystal Beach Cottages, and Lake Township for the 2025 summer months, subject to approval as to form by legal counsel and authorizes the chair to sign.
Can I get support? Awesome. Thank you, Gary. Other questions or comments?
The Village of Honor didn't reach out to you this year?
No, sir, they did not.
Village of Lake Ann didn't reach out to you, sir?
I
Not officially.
suspect the Village of Honor will be again.
I'm sorry.
Suspect the Village of Honor will be again.
Okay.
So
As-
that means we'll see this,
As
see
well.
something again,
If,
probably.
if I can
Potentially.
find a
Yeah.
coverage for it, yes.
Oh, well, that's a key,
A
right?
lot of this is not only is our
Very
willingness,
key.
but it's do we have the staff to meet the demand of the lease? And so we do have to we have to consider that before we agree.
Got it.
Absolutely.
Other questions or comments? Hearing none, roll call, please.
Sauer?
Yes.
Trigg?
Yes.
Janat?
Yes.
Markey?
Yes.
Nye?
Yes.
Roloffs?
Yes.
Motion carried.
Katie?
The next item in the agenda is a memorandum of agreement for leadership and leadership consulting, specifically for the sheriff's office and central dispatch office. Corey Ellis I think it was Corey Ellis who found this group who does leadership training, specifically, quite frankly, for law enforcement first responders. And so they obviously offer other trainings too for others, but this is specific to the folks in the sheriff's office, giving them those skills to really do the jobs that they do every day that many of us probably couldn't handle. And so we've all spoken here around this horseshoe many a times that we believe that training and adding tools to your toolbox is just absolutely important, and supporting those in our first responder agencies is absolutely important. So this would be to provide training to those folks up the hill, and the funding would come from both departments, which we have budgeted funding for training. So there's no budget amendment necessary.
Can I get a motion to approve?
Trigg moves that the Board of Commissioners approves the memorandum of agreement with Peak Leadership and Consulting LLC to provide training to the Sheriff's Office and Central Dispatch in the not to exceed amount of $5,950 with funds available in the Central Dispatch and Sheriff's Training Funds, and authorizes the chair to sign.
Thank you. Support?
Mark, you'll support.
Thank you, Tim. One more any more questions, comments?
I have a question.
Please.
Did, during your research, were there other agencies that provided similar training?
So I kind of spearheaded this one. There's other agencies that provide the topic that is for this specific training. However, when I reviewed their bullet points or talking points or their outline, it was not as in-depth as this gentleman's. So I felt that we were getting a lot better value out of this gentleman's training. There's also some side value. He is currently, his day job, he calls it, is he's the leadership development manager for the Michigan State Police, for all of Michigan State Police. So that value in itself also comes to us.
I was just wondering if we got multiple quotes for this, kind of like we try to do for almost all those things that we go out for that are over a certain dollar amount.
Sure. Yeah. We did not put it out for any sort of RFP or anything like that. One of the challenges we run into is we in dispatch cannot pay any sort of vendor or person if they are not vetted through the state. And so that list then narrows it down even more. And so when I go and look at this topic, there's two. And so I did look at the other one that would have been viable. And I kind of made that decision as I didn't think it was as great of a value. So, and I know the Sheriff's Department runs into the same or similar for their MGOLS funding. I don't know what their process is. The sheriff would have to answer to that, but we share similar challenges when we try to find training.
Other questions or comments? Hearing none, roll call, please.
Trigg,
Yes.
Janat,
Yes.
Markey,
Yes.
Nye,
Yes.
Roloff.
Yes.
Sauer,
Yes.
motion carried.
Katie?
The next item in your agenda is a budget amendment related to a patrol vehicle sale. We were able to retire and sell one of our vehicles, and this is to recognize that budget amendment for the sale of that vehicle. This would go into the equipment replacement fund, which is then utilized for things like tires and those sorts of things on the existing patrol vehicles that we have.
I move that the Board of Commissioners authorizes a budget amendment in the amount of $6,868.70 to the Equipment Replacement Fund.
I'll support. Thank you. Questions or comments? Hearing none? Call.
Janat,
Yes.
Markey,
Yes.
Nye,
Yes.
Roloff.
Yes.
Sauer,
Yes.
Trigg,
Yes.
motion carried.
Thank you all.
The next item in your agenda is the Frankfurt Recycling Site lease. After many, many months, as the mayor indicated, of discussions, we were able to come to a lease agreement for the recycling site in Frankfurt. That site where it stands now was always intended to be more temporary. And so we've been working over the last couple of years to identify an alternative. So after conversations with Mr. Rainier, he agreed to allow us to move the bins back to his property. And the lease that's in your agenda is really very similar to the other site leases we have in the county, with some additional information in there, being that it's a 3-way lease versus a 2-way lease. So the agreement does specifically say, at least one bin and, at least twice a month things are picked up. We strive for much, much more than that, but that's really a baseline of what we put into all the leases. And then as there's a need that is shown, or if bins become more available from GFL, we extend the presence of those bins at those locations. We know Frankfurt is really our biggest site that we have. And so the intention is not to shrink that down by any means. And the conversations we've had with GFL is potentially we'll add more bins as they have them available. The idea is to do the move in May. So here in the next couple of weeks, make the move over to Mr. Rainier's property. And in that timeline, they're going to replace all the old red bins to be the newer green bins in Frankfort as well as across the county. So you're going to start to see all those red bins disappear, and it'll be the newer green bins that will appear at the recycling sites.
Yeah, I'd like to make a comment just that in my meeting with Mr. Rainier, it didn't take any convincing to nudge him towards serving his community. He's done a lot of things in the past for our community, and he doesn't do it for recognition. He does it because it's the right thing to do. And it was a pleasure to meet with him.
Like to make that motion?
Yeah, I'd be happy to make that motion. That the Board of Commissioners approves the site lease agreement for the Frankfort recycling site in Benzie County for a period of 2 years. Such agreement subject to approval as to its form by legal counsel, and authorizes the chair to sign.
Trigg will second.
Thank you. Additional comments, questions? Hearing none, roll call, please.
Markey,
Yes.
Nye,
Yes.
Roloff.
Yes.
Sauer,
Yes.
Trigg,
Yes.
Janat,
Yes.
motion carried.
As before we move on, I want to recognize Commissioner Nye. You, at my request, stepped forward and approached Mr. Rainier. I think that was the right thing. I think the right personality. I want to thank Mr. Rainier. I don't believe he's here with us today,
Nope.
but couldn't be more pleased about a citizen being willing to make that kind of commitment. And also, I want to recognize the city. It was a three-way negotiation that had to take place, and this is the right thing for the community. So thank you for your efforts.
Welcome.
Katie?
The next item on the agenda is related to the Road Commission bond proposal. We do have representatives from the Road Commission here. I don't think we have the folks online anymore because they had another obligation related to that. But in your packet, you'll see the resolution as well as the schedule based on bond payments if approved by the voters. This resolution would place ballot language on the ballot for November specifically. And so what is in front of you today is to move forward with that process, similarly what we did a year ago, so that the Road Commission can go through their educational efforts as well as place it on the ballot in November for Tammy to facilitate that process.
And when you mentioned someone joining us remotely, that was to discuss the schedule for the bond payment, is that right?
Yep, but they had another obligation at 11 o'clock, and so they're not on anymore.
Not a problem. You have, commissioners have that in front of them.
Yep.
That they can review. We've had a lot of discussion on this over the last several months. Would anybody like to make a motion?
I'll make the motion that the Board of Commissioners adopts Resolution 2512. Resolution submitting Road Commission facility bond proposal for placement in the November 4th, 2025 general election ballot, and authorize engagement letters with Miller Canfield and Bedinsky and Company for services related to the bond contingent upon the bond approval by the electorate.
I'll support. Thank you. Questions or comments? I do have one. If I could, for the Road Commission, can you step up to the microphone? Thanks for being here today, by the way.
No problem.
One of the commissioners commented in, if not the last meeting, a recent meeting, that talked about shortening the term of the bond. And I know there was a discussion about what kind of burden does that put on the taxpayer, et cetera. But sometimes by shortening the bond, the per household expense doesn't really go up that much because there's other benefits to a shorter term. Has that been explored at all?
I think Bob might be better to answer that one. I know we've explored it in the past, and the millage rate went up substantially higher per year, which we thought would put a burden on the taxpayers, which is why we went with the 20 years. The bond rate for the 20 years was around that 4.3% last year. I think he has it up to about 5% currently, just to be on that heavy side, but I don't know what a 10-year is at currently, but shortening that 20 mil into 10 years or 18 mil into 10 years as opposed to 20 years would be a substantial increase.
Okay, so you have looked at it.
Looked into it.
And based on your board's review of it, you felt like it just didn't make sense in this particular case?
Yeah, I mean, I don't mean to answer for him. He is here, but he is the one that said, yes, it would put a burden on the taxpayers trying to shorten it down to 10 years.
All right. I just wanted to make sure we came around and asked that question again, because sometimes it's not as dramatic as it seems. For instance, you didn't have to go from 20 to 10. You could have gone from 18 or whatever length of duration you want to 15. But I appreciate the fact you've looked at it. And maybe we'll take, if you would consider as interest rates change and they're subject to, we maybe take another look at that again for an opportunity to reduce that term. But I'm not affecting this motion.
Sure. And I do want to note too, the ballot language that we're presenting to the voters, it has the language of up to and not to exceed. And so there is opportunity for the road commission and the county to talk about that and look at what that looks like, because the language is specific that it's in the sum not to exceed 18 million and payable and not to exceed 20 years.
Okay.
So it's not saying it has to be 20 years, it's saying not to. And so maybe those are some conversations we can have here in the next couple of months. And maybe it looks like an 18-year versus a 20-year. The ballot language would allow for that.
And don't take any of my comments as being disparaging. I'm supportive of this. I'm just looking at, what economically, what does it look best for the community down the road? Sometimes we don't think far enough down. 2 to 5 years reduction can mean a lot, especially if we're having to go out for another bond for something else. All right.
Chair, I'm wondering, would it be appropriate, we have Exhibit A in our packet, would it be appropriate to read the millage language? So for people listening or who come to watch the YouTube channel to know what they'll be seeing in November?
Well, now that you brought it up, why don't you do that?
I'd be happy to.
If you wouldn't mind.
Exhibit A, Benzie County Road Commission Facility Bond Proposal. Shall the County of Benzie, Michigan borrow the sum of not to exceed $18 million and issue its general obligation unlimited tax bonds in one or more series payable in not to exceed 20 years from the date of issuance for the purpose of paying all or part of the costs to acquire, construct, furnish, and equip a new road commission facility, including garage and administration facilities, together with all related site improvements. Below that, it states the estimated millage to be leveled in the first year of the levy in 2027 is 0.6981 mils, which is 6.6981 per thousand of taxable value. And the estimated simple average annual millage rate required to retire the bonds is 0.672 mils, which is 0.672 per thousand of taxable value. Yes or no?
And that's the language that we're approving today.
Yes.
Correct. And I'd like to note too, for the benefit of the public, this would not levy until 2027. So when folks are considering this, they need to consider 2 years from now of when they would actually see that levy on their tax bill.
And to your point a moment ago, because of the way the language is structured, we could actually make the decision on the duration even after the bond millage passes.
Yes.
Yeah. Okay.
Mm-hmm. So, because I mean, given the market and the way things look for percentage rates and such, maybe it makes sense to shorten it by 2 years or 1 year or what have you. Maybe that makes sense. We don't know, because we're looking, we're looking 18 months out to 2 years when we're actually levying and selling the bonds and those sorts of things.
Good. Bob, I'm not trying to complicate it. I'm just looking for efficiencies.
Been trying to get him up here, but he just won't.
I see that. He was pretty stuck in that chair. All right, I appreciate it. Any other questions or comments? If not, let's bring it to a vote.
Nye,
Yes.
Roloffs,
Yes.
Sauer,
Yes.
Craig,
Yes.
Janat,
Yes,
Markey,
Yes.
motion carried.
thank you.
Thanks, Troy.
The next item on your agenda is an agreement with the Benzie-Leelanau Health Department to work with them regarding the marijuana operation and oversight grant. You'll recall last fiscal year, Benzie County was successful in obtaining an operations and oversight grant from the marijuana industry in Michigan. We've again able to secure those funds, and the idea of these funds is to educate and promote prevention and safety of the use of marijuana within our county. This year, Leelanau County was also successful in obtaining these funds, and so the health department is working with both of us to oversee these funds and really get that campaign out into our region. You will notice when you're driving out of town, you'll see the big billboard and it's, lock up your marijuana. That's part of this grant. So our logo is on there. It's pretty cool to see a billboard with Benzie County's logo. But this agreement in your packet is really having the health department assist administration in the management of this grant. Last year, we took on much more of the burden, but the health department really is stepped up to assist us with the management of this grant this year, which we appreciate.
Very good. I'd entertain a motion.
Trigg moves that the Board of Commissioners approves the agreement for services marijuana grant management services, such agreement subject to approval as to its form by legal counsel, and authorizes the chair to sign.
9 seconds.
Thank you. Questions or comments before we vote?
So the funding will go directly to the health department?
No, it's all
To us.
it's all reimbursement.
Oh.
And so you have to spend the money and then get reimbursement after. Last year, the state was great in giving the reimbursements on a rather quickly turnaround. So that was helpful as well. So it still has to funnel through that reimbursement style that way.
So does the health department ask for the reimbursements or?
We will work through that, but Rachel will probably ask for the reimbursements on our behalf.
I think it's complicated as.
No, it won't be complicated. I've already been speaking with Rachel on this, Rachel Pomeroy. She's been great. So it'll be great.
Other comments or questions? Hearing none. Vote please.
Roloffs,
Yes.
Sauer,
Yes.
Trigg,
Yes.
Janat,
Yes.
Markey,
Yes.
Nye,
Yes.
motion carried.
The next item on your agenda is Parks and Recreation Plan update. The Benzie County Parks and Recreation Plan had expired at the end of 2024. The Parks and Recreation Commission, we did publish an RFP and they considered the proposals that came forward. You'll see in your packet, we received a proposal from Sarah Kirk as well as Networks Northwest. The Parks and Recreation Commission has recommended moving forward with Sarah Kirk. She was the low bidder, and being that she is local, many people are aware of the quality of work she does, which is very good quality. It is important to note that while our plan is expired, there are certain funding opportunities that Benzie County is not eligible for related to the parks. And so it's very important that we get this plan updated and approved so that we're not restricting ourselves in finding funds.
Gary, would you like to make that motion?
Sure. Board of Commissioners accepts a proposal from SRP Design Studio for the Benzie County Parks and Rec Plan. Update to not to exceed amount of $13,315 with funds available in the Parks and Recreation Department budget.
Markey will support.
Thank you, Tim. Other questions or comments? Hearing none. Vote please.
Sauer,
Yes.
Trigg,
Yes.
Janat,
Yes.
Markey,
Yes.
Nye,
Yes.
Roloffs.
Yes.
Motion carried.
Katie?
So the next item is related to the Betsy Valley Trail paving project, and I'm sure everyone who came to the building today saw the work being done just down the hill here on the trail. Elmer's is out there laying the proper groundwork to then pave that trail from downtown Beulah here up to Case Road. We have worked to ensure that the pavement overlay is snowmobile rated. So that is a concern that has been lied. But with paving of that trail, you'll notice that we are crossing a dirt road, and that's Richards Road. I do want to clarify, everyone has called it Richardson Road until Thursday when I noted it was Richards Road. And so Richards Road is a dirt road. And so that paving is going to cross a dirt road, which is an issue all in itself when it comes to maintaining that dirt road in the winter months. And so in the spirit of helping to lower the cost of maintenance every single year, we talked with the Road Commission and Benzonia Township about paving the approach to the trail to help maintain the longevity of the trail. If we just have the trail paved, as they come down that hill with a snowplow, they're going to clip that edge. And that is an issue because then we're going to be repairing that part of the trail every single year. So the idea is to work together to pave the approaches to protect the longevity of that trail. The Road Commission has agreed to do all the legwork to prepare it for paving at no cost to the county. They're partnering in that sense. And based on the conversations with Jason Barnard at Benzonia Township and the funding they have available for local roads, they're also willing to cost share that specifically. The way I have your motion written today in the not to exceed amount of 18,000 is the idea that Benzie County is paying the bill with Benzonia Township, then reimbursing back towards the county for part of that cost. And like I said, the road commission is doing all of the groundwork at no cost. So they're prepping all the land at no cost to then cover that. We have the funding in the general fund balance to help with this. This is separate from the grant. The grant won't allow us to do this. However, based on all the conversations that we've had with the DNR and with Elmer's, it makes sense to do this to help maintain the trail crossing there on Richards Road. And so I humbly believe it would be very important and a great choice for the county to support this add-on to the project with its general fund dollars. Our trail is one of our best assets here in Benzie County, and I want to make sure we're maintaining that the best that we can.
I'd entertain a motion.
Read this one too. That the Board of Commissioners authorize funding in the not to exceed amount of 18,000 for road improvements to Richards Road as part of the Betsy Valley Trail paving project with funds available in general fund.
Fund
General
balance.
fund balance, yeah, okay. There's only supposed to be one fund. With cost sharing reimbursements and in-kind work to be completed by Benzonia Township and the Road Commission for the project.
Did I get support?
Trigg will second.
Thank you. Questions or comments?
Katie, did I hear you say how much Benzonia plans on reimbursing?
Based on the conversations we have had, they're looking at reimbursing up to 50% of that 18,000. So the 18,000 is just the paving itself, the materials itself. The road commission will do all of the excavation and the prep of the land. And then that's just the pavement cost. That pavement cost is under the approved amount approved by the road commission for the overall paving in the county. So it's at a pretty great rate to do that specifically. So we're getting that large quantity cost through the road commission because they included it as part of their proposal.
Sure, but monetary reimbursement, we're under the assumption it'll be $9,000.
Correct. Yep.
Okay.
Just a thought. I'm thinking that Benzonia Township is probably looking at the match funds from the road commission.
That's
50% match,
yes.
so basically the township would probably kick in 4,500 and the other 4,500
Comes from the road commission.
That'd
Fair
be my
enough.
guess.
Yeah.
That's the conversations that we've had.
But those funds are designated specifically to
Local roads.
local roads from, specifically to Benzonia Township.
Right.
From the road commission,
Mhm.
so. It may not be coming out of their general fund, but it's coming out of the pot of money they get to use.
Yeah.
Right.
And based on my conversations with Troy, the work that they're going to be doing for no cost to the county well exceeds $15,000. So we really are appreciative for that in-kind work.
So I think it's great forward thinking. Any other questions or comments? If not, roll call, please.
Greg,
Yes.
Janat,
Yes.
Markey,
Yes.
Knight,
Yes.
Roloff,
Yes.
Sauer.
Yes.
Motion carried.
Katie, committee appointments, you want to
Abs-
talk about that?
Yes, so in your packet is reaffirmation of the Tax Advisory Committee. This board established the Tax Advisory Committee through resolution a few meetings ago. And during that time, we talked about the fact that we wanted this committee to really stay the same as much as possible as the committee from the prior time. And so in your packet is simply reaffirming those members. I've had conversations with Randy Rice. He is absolutely wanting to serve on that committee again. The judge's appointment is Mandy Gray Rainier. She's also agreed to be on there and has the time. The supervisors have all agreed that Jason Barnhart seems like the likely chosen person for them as well. Kelly Long is statutory on that committee, and Matt Olson is also statutory on that committee. And he is a Benzie resident, so it makes sense for him. So the two in your question in the motion is one, Randy Rice, so it's reappointing him. And then also in the resolution, it's the Finance Committee Chair or Board's designee. Last time you appointed myself, so that's what the motion reflects.
You're comfortable with that? We have a motion that's prepared.
Yeah, Nye moves that the Board of Commissioners reaffirms the appointment of Randy Rice to the Tax Limitation Advisory Committee in addition to the county administrator as the board's designee to the committee to discuss Benzie County's operating millage requests.
Any support?
I'll support.
Thank you. Questions or comments? When would this tax committee first meet?
So this statute requires that once it's officially formed, it must meet within 10 days. And so I will be working to schedule our first meeting within 10 days of today to start those conversations. Statutorily, also, this committee is only in place for 1 year. And so you will have to reappoint the committee again in the spring so that we can finish out the final steps before it is placed on a ballot in 2026, whatever that ballot language may be. So within 10 days, I'm going to work to get that scheduled. There will be other folks at the table, Brianne Lindsay specifically, being that she's with all the properties and can help show the history of the taxable value and such. So she really does sit at the horseshoe with us and play an integral role in this committee. And the idea of forming this so early and starting these conversations is so that we can hold enough meetings to help educate the community as to why and what the need is for the county, as well as what does the county want us to look like, the community, what do they want the county to look like? So we're giving ourselves ample time to really hold those sessions.
Just wanted to stress, because it wasn't going to be on the ballot for more than a year, we will have to readdress this next year, and you've already stated that.
Yep.
All right, and is that a roll call or is that voice?
Roll.
Please.
Janat,
Yes.
Markey,
Yes.
Nye,
Yes.
Roloff.
Yep.
Sauer,
Yes.
Craig,
Yes.
motion carried.
And just for the record, with Commissioner Worsecki resigning from the board effective the 25th of this month, I've approached Gary to act as our liaison to the busing authority until further notice. You did agree to that, right?
Good night.
We had the
Yeah,
conversation.
not till next week or next month.
All right.
Are you
So
sure?
if the record
This
will
is
just
a total-
reflect that, please. All right, Commissioner reports. Commissioner Rojas, I know you have some time constraints. So is there anything that you'd like to share with the group in case you have to leave?
I did meet with the Veterans Affairs for the past 2 months, with somewhat limited capacity, but we wanted to talk especially about Memorial Day celebration, and it will be on Memorial Day at 1 o'clock. Look forward to seeing whoever can make it. We look forward to putting on a pretty good presentation as we always do. 1 o'clock at the Veterans Memorial.
Any questions? Yes.
Just one, and that came up at the MAC conference. The grants you guys get through the state, there's been, if I understand it correctly, quite an influx in counties applying for it. And I don't know if you've heard anything, they actually have asked that you reduce the amount wanted to ask for.
I do know at our last meeting, we denied writing for one of those grants.
You denied.
Yeah.
You decided not to do it.
Correct.
I just didn't know if it was affecting you guys or not.
So I'm glad you brought that up because it sparked something else. We all know Karen Korolenko, the Veterans Affairs Director, is out because of health issues. I believe there is a posting on her door with a phone number on it. The VA phone 0034 has been forwarded to her home cell phone. So she is reachable. She is working from home, easily contacted. I've received a message from Grand Traverse County Veterans Director, wanting to know what's going on in Benzie County. I've yet to respond to him because I thought I should take time to be a little more cordial. But he said they couldn't get a hold of her and there was nothing saying, you know, how to get a hold of her. So before I have that conversation with Mr. Roof, I wanted to make sure all my T's were crossed and I's were dotted.
I will add to that he called me yesterday, and I talked to him about that as well. They said that they weren't leaving messages because they thought it was weird it was forwarded. So there was no opportunity for her to even respond to Grand Traverse County because they never left her a message as to what they were calling about. So I did communicate that to the Grand Traverse Veterans Affairs folks yesterday. what's going on and that they should be leaving a message or emailing her. They hadn't emailed her either. I can tell you that our office has been in communication with her. She's very responsive. She's responding to emails. So
Just two comments, but first, I have every confidence in the VA board's ability to oversee that activity. So what decisions you guys make and how you manage that remotely, I trust that.
Appreciate it.
Secondly, I want to tell you that personally, I'm very pleased that you're back. Your participation is valuable to us.
I was saving this until committee reports, but I'm glad you brought it up, and I need to thank every one of you that has reached out to me over the last couple months. It's been a little awkward for me to be in this kind of position. I don't like to be compromised very much, so it's been a life-changing event, but thank you all for your support.
Glad you're sitting with us today.
Me as well.
Tim?
Thank you.
Homestead Township Board, they're working on updating the township's capital improvement plan. And they met with HARP, the Honor Area Restoration Project, and pointed out that the township has spent close to $100,000 more than agreed to on the Platte River Park. And that HARP indicated that they would be working on correcting that discrepancy. But HARP did recognize that, yeah, they committed to some things that they didn't do. Central Wellness Network Board, the board was presented with their audit results from their financial audits. And the audit was presents fairly in all material respects. So a good audit. We got an update from the region. And this is just my understanding of some things that the region is they put into a full risk contract, which basically talks about each CMH in the region has to put in a certain percentage of their budget for a contingency fund or like a rainy day fund. And they adjusted the contract so that when a CMH gets into a position where they need to draw on that rainy day fund, they can only draw on the funds they put in first. And then once those funds are gone, then they should be going back to their counties to fill in that gap, opposed to drawing on everybody else's funds that they put into the rainy day fund. That's all I have for the Central Nelson Board. Commissioner, she was there, she may have more on that. LEPC and LPT meetings. We updated the bylaws for the local emergency planning committee. They were approved by the LEPC. We went through the off-site response plans for Graceland Fruits, Main Street and Forester Roads facilities, and both were approved. At the LPT meeting, we reviewed the Emergency Operations Plan Annex B, which is damage assessment, and Annex G, which is public health and medical, and both were approved. Also, our emergency manager, Rebecca Hubers, went through some of the things that she highlighted from the ice storms that recently hit north and east of us. Like an example, she pointed out that they're running into issues with fuel. It's good to know where fuel stations have backup generators. When you have an extended outage over a large area, you don't have any place to get fuels. All these people with generators that require diesel or whatever, those things are going to run out quickly, and then they're not going to have any place to get it refilled. That's just an example of the things that she highlighted that she noticed.
Questions for Tim? Thank you. Gary? Oh, you have a question?
Yes, I have a question if I may.
Please.
You talked about the CMH rainy day fund. I think I'm a little confused. So there's funds other than what CMH puts in there?
There's
ISF fund, internal service fund.
the Internal Service Fund. The region, it's the NMRE, the Northern Michigan Regional Entity, oversees all of the CMH's
in this region. I think there's like 10 of them. Spanning lots of counties. Ours is Central Wellness, which is Benzie Manistee. Each CMH puts into this fund. Okay, that the region holds. And then each CMH, if they need to, in other words, they get into an area where they're behind, they can draw off that fund. But they changed the contract to make it so you can't just take everybody else's funds that they put in there too.
I see. So if Benzie County goes over, dips into the rainy day fund, they can only touch Benzie County funds. And then after that, they
Well,
come to us.
Central Wellness.
Yeah, and quite honestly, there were people drawing from the fund who had not contributed. And that didn't go over well.
There are certain CMHs that were always in the rears.
Gotcha.
They were not being that good of stewards of their finances.
Understand. Thank you. Thank you for that clarification.
Else, Christie. Gary, please.
Well, me. Let's go to the MAC conference with everybody. A little different this year. They kept us in one room and it's kind of hard on my hind end all day anyway. But it was nice to be able to hear all the stuff that was said and I know this is Katie's favorite was the Michigan juvenile bed shortage. Let that go. And Katie and Michael did the ransomware attacks that happened here. Gave a very good presentation. Extremely nice. Then they talked about the the Constitutional Convention, which most people, I guess, don't pay any attention to it, or every so often this gets voted on. It's coming up in 26. If it passes, we would have a constitutional convention. The Constitution has not been touched since the 60s. It would be an opportunity to fix some things in the Constitution, but it would open it up again too. So most of the time it doesn't pass. I can't remember the numbers, less than 35–40% would vote in favor of opening it back up. But I think a lot of it's because they don't inform people what's going on. I always refer back to the voting issues that somehow they thought was a great idea. I think constitutionally, those things could be repaired. Just a thought. I don't know. It was interesting. We had a couple of one round table with a couple of senators and state reps, and a one side versus the other side. It was interesting. And they talked about possible road fixes as far as financially. The idea was at the House, I believe, that wants to take the sales tax from gasoline to go to the road. And their spreadsheet indicated that it would almost double the MTF fund. You gotta get through the Senate, you gotta get through everybody else, and the sad part is the budget, I believe, my numbers are never correct, you guys can straighten me out. When the current governor came into office, there was somewhere around 40 billion. The last one they just approved or plan to approve is looking at 80 billion, so it has doubled. Sorry, could have been able to fix a damn road somewhere along the line there. I better quit. My tax is coming back around. Just to let everybody know. Some of the local stuff I went to with Joyfield, they were trying to do a trio for green energy. At the township, it was part of their zoning thing that got defeated. Well, they didn't go any farther. They basically tried to keep it in one area. I don't know if you can, because the Michigan, whatever they call them, the one that's in charge of all that, probably would not allow, if you have a CREO, you have to have at least no more stringent requirements than what the state gonna do. And course, that's being sued now too, because tell me. That small group of 4 or 5 people have exceeded their authority. And they're being sued by a lot of the townships, so see where that goes. They opted out of the designated assessor. That's 2 townships I have. I don't know if we're there yet or not. Plain Township, they signed letters for Gary Cap.
Gosh,
They did, because we were told Friday they didn't.
One of them individually signed a letter supporting the bead program for.
Blaine did.
Blaine and Gilmore, I was told, did not sign.
Yeah, we were told
Blaine did,
Friday.
I
they
was sitting
Blaine
there when they
didn't.
signed them.
Then that happened after it was announced to me.
Must be.
Their meeting was on the 3rd.
Submitted in time?
Yeah, this was last
I
Yeah.
thought they gave them to.
Monday, I heard it.
They must not have, because on Friday,
To Tim's son. I
Tim
thought.
Malone said they did not sign a letter for them.
Right.
Well, his son was there, so.
Oh, yeah, and that was repeated again on Friday, wasn't it?
Mm-hmm.
I'm sorry to hear that. Set through the MAC and ag and environmental. We're doing platform reviews. Didn't get on, we didn't even finish getting through the environmental, but all they are is a kind of a guideline for, MAC to discuss with the state reps and the state senators, so. Village of Thompsonville signed the lease agreement for the property over there. The Diamond Crossing. And their blight enforcement officer resigned. Another problem with blight. And then I went to the Village of Alberta. One of the trustees resigned, Brett McGregor, because he moved out of the area. And they approved a new planning commission individual, Jim Baldwin, so. They also said something that I gotta say, I'm sorry. Must have been with the land bank came over there, and Shelley must have came over there and discussed the possibilities for the property along the lake shore. Anyway, they wanted me to tell you that thought Shelley was great. She's wonderful, and they love her. So pass it on for me, please. Thank you.
You had us scared the way you introduced that.
I never know.
That's quite a buildup there, Gary.
Yeah, jeez. Wow.
Anything else, Gary?
That's it. Thank you.
Questions for Gary?
no.
Cause he can make it as dramatic for you.
Oh, they shocked me, I gotta say that.
Christie?
Yep. So, as I've communicated out before, I've been on, out of state, for the last couple of weeks. I was back in time for the Economic Development and Brownfield Redevelopment. Authority.
She means Florida.
Yes, yes, I took my daughter to Disney. We were updated on the working group. And the working group was, Commissioner Janat, Betsy Evans. I can't think of, Mr. Gustav, Eric yes, Gustad. And I believe the, contractor, Steve Arwood, was in on that as well.
Yes, and then 3 from the chamber.
And then 3 from the chamber. And so, this, committee, I don't know, maybe you should talk more on this than me, but
I'll fill in any blanks. Go ahead.
very good. They, so this committee was put together to, kind of, talk about what, this new body, was going to kind of be. And so they talk about, keeping their 501c6 status, which is the same as, a chamber. They talked about, chamber, will put up $40,000. They're asking the county to match the 40,000, and then the rest of the 175,000 would come from grants, private donations, philanthropy. They talked about a long-term commitment, which is to expand the tax base, leverage the brownfield, as the status has been expanded to not just contaminated, sites, but also, abandoned and whatnot. Increased jobs. And, they're asking that, for at least 3 to 5 years, probably close to that 5 years to realize these benefits. They talked about staff hiring, the CEO and an assistant that would probably work from home to start, and job descriptions are pending. And that's basically what I had for the new body. We also had Tim Malone come from Cherry Capital Airport, and I'm sorry, Cherry Capital Communications. And he talked about this public-private partnership, getting fiber to the home. Again, we talked about April 9th. They are one of 40 companies to bid on $1.55 billion in state money for the NCIA grant. They were able to bid on areas that Mercury forfeited, about $75,000 worth. One problem they're running into is that data is not current and is a bit invalid. And so they do not know where the houses are. And they're asking for residents to go to their website, portal.cccfiber.com, to go in there, let them know where you are and what you're interested in. And they talked about the other grants, the Robin and the BEAD. So Robin, boy, this seems like a big number, but I put 2,552 houses in Colfax and Inland. And they're looking at 2 years to completion on that. And BEAD, they're bidding on 913 houses in Blaine and Gilmore and Lake Townships. And they're looking at a 4 years to completion there. Under BEAD, what they are doing is it's kind of an equity. So for people who qualify, they will have a lower a monthly pay rate for service. And they have a breakdown. You can get 100 megabytes, 250, 500, and a gig. And based on regular pricing, those who qualified through BEAD get a significant discount. And so that's helpful. We also had a couple of folks in the meeting talk about how they were satisfied customers with Cherry Capital Communications. One thing that they talked about is when they were with Charter, they were not getting what they signed up for. That their level of service, while they said they wanted a gig, maybe they weren't getting a gig, but they were still paying for it. And now these customers are on Cherry Capital and they're getting what they're paying for. And so they're very satisfied customers. Yes, and that was basically the meeting. I probably gave more information than I needed to.
Not at all. I do just a couple of things if I could. Katie.
Yes, please.
When you mentioned the 913 households, that's Benzie County wide that are eligible for BEAD.
Right.
All right. And the 2,252 are total locations passed throughout Benzie County.
Okay.
Not just the 2 townships you'd mentioned.
Okay.
So just
that clarification.
Sure. And with respect to the private-public partnership with the EDC, we're going to spend a good deal of time at the study session at the next meeting. So I think I'll leave any additional comments to that study session, other than to say that we need to look at the future of Benzie County, and what that future looks like is the investment we'll make today. Any questions for Christy? Rhonda?
Yeah, thank you. I also attended the MAC conference with Gary and Katie in Lansing, and MAC's 2025 priorities were listed as the Revenue Sharing Trust Fund, Veterans Property Tax Reimbursement, Earned Sick Time Act, trial court funding, and road funding. Those are the priorities this year. The addressing the juvenile beds, Cam Clark was on that panel, who used to work for Benzie County, just saying that knuckles up for 41 counties don't have beds for juveniles, and the costs that counties incur shipping them to places that do have beds. Couple other breakout session, we didn't break out, we stayed in the same room. We all saw the same thing. Getting housing built, how counties can leverage state resources, addressing the healthcare challenge. As Gary said, the return of X My Tax, which may sound very appealing to taxpayers to not have property taxes anymore, but the discussion was really focused on if that went through, what's going to happen. There's no recourse for how things would be funded, and it would pose a significant issue for counties. One of the breakout sessions was what the heck is a con anyway? As Gary said, the Constitutional Convention, which happens every 16 years, it's coming up. If that moves forward, the opportunity to amend the Constitution, and just as Gary said, seems like it'd be a good idea, but there's reasons that it's not too. Navigating workplace trends was discussed, practical strategies for Michigan County leaders. One takeaway I thought with that presentation, they talked about how counties typically do exit interviews. And they said the new thing is now stay interviews. You talk to your middle and high performing employees who really do well at their job over long term, and talk to them about why they stay, what they find appealing about their job, instead of just talking to people as they're out the door. Talk to them while they're still there so you can implement the things that they see or do better in areas. I thought that was interesting. MAC had documents provided. These are their issue briefs. There are 4 of them: Medicaid 111 waivers, revenue sharing trust fund, road funding, and the indigent defense expansion. And these all have a background, MAC's efforts, and key insights. I grabbed some if anybody wants copies. So I also attended the Benzonia Township regular meeting. Their cleanup day changed because Northern Disposal gave them a quote at half the price that Republic did. So the new spring cleanup is going to be on May 3rd from 7 to 10 a.m. Their new website will be done in a couple of weeks. They had an order from a judge for mediation for the Crystal Lake watershed suit, which involves Benzonia Township, the West Benzie Joint Planning Commission, and Jason Bernard. And the Conservation District made a formal offer on the Benzonia Township building at $325,000 based on an appraisal the Conservation District secured. I also attended Central Wellness. Tim gave a great update. One thing that he didn't touch on, Karen Goodman, who retired from Central Wellness and is a Manistee commissioner, is a new board member, and she will be replacing Richard Schmidt on the Central Wellness Board. And there's also an effort, I don't think Tim mentioned this, an effort to establish administrative service organizations in place of TIHPs, which would open contracts to private entities. So this is another effort to privatize, to offer the contracts that Central Wellness has to Blue Cross Blue Shield, Priority Health, who really only want the lucrative big payout clients, and would really just save the costly clients, the ones who aren't as desirable monetarily, back to our community mental health. So that's always problematic. I did call into the EDC meeting. Great report on that. You covered a lot, or almost everything. And I had agenda review. And then yesterday I attended a Benzonia Township special meeting. They were meeting with their attorney from Micah Myers to discuss the Crystal Lake watershed lawsuit. They went into closed session. They came out of closed session and did not take any action to accept any recommendation or anything like that. And a lot of public comment was heard. I think it's an understatement to say that there is community concern, I dare say dissatisfaction with the state of lawsuits in my township, and especially this one. There appeared to have been an offer to settle issued that it's not clear whether the whole board saw or not. So that's where that stood. And that's all I have.
Any questions or comments? Rhonda? All right, Rhonda, thank you. I'm just gonna highlight a couple of things, and then I invite you to read my report that's in your packet. I do want to let you know that the early Head Start programs, as well as the Meals on Wheels, based on what's happening at the federal level, are all in jeopardy right now. They announced last Thursday that Head Start or no, Meals on Wheels was not going to be funded. I don't know what the implications of that for Benzie Senior Resources, but I'll reach back out to them. I didn't want to take too much time today getting into that conversation. Also, we're trying to establish a Head Start operation here in Benzie County, as well as a satellite office for the Community Action Agency. I'm not sure how all this affects it, but there's more information to come. I chair that organization, so I'll be following it very closely. I want to comment on the fact that I do meet with a number of elected officials and some community leaders on a regular basis. I know that I've been meeting with the sheriff's office. I found that very productive. I hope that you guys have too, as well as the city of Frankfurt with the mayor there and talking with some of the department heads. It's amazing what you learn when you get a chance to ask some questions and find out what's going on in their world. And last comment that I'll make is that Rhonda and I are scheduled with Katie to meet with MMRMA. It's a conversation that I would like to get your questions answered if you should have any. And I'd ask you to get those questions then to Katie, and we'll be sure to get answers for you. But that visit will be coming up shortly, and that's an educational system or process basically for us. Any questions? If not, we'll move on to the administrator's report.
Sure. So I was asked to read Commissioner Evan Worsecki's resignation letter, so I'll start with that. He sent a resignation letter on April 7th, and he said, as previously discussed, I will be stepping down as commissioner from the District 6 County Commission seat. This resignation will be effective April 25th, 2025. Please forward this correspondence to the appropriate individuals. So as almost everyone knows, Evan Worsecki is stepping down. That has been published in the Record Patriot as of Wednesday. And again, tomorrow. It's also on the homepage of our website. So if there are folks who live within Commissioner Worsecki's district, which is Colfax Township and the majority of Inland Township, you're welcome to submit your letter of interest and resume to the county clerk. And we'll be taking those. We do tentatively plan to conduct interviews on May 6th of the candidates. So please get your letters in sooner than later and spread the word if you know of anybody interested.
Katie, before you leave that, if we could, I think we should act formally on the resignation and the effective date. So I know it's out of protocol, but as the chair, I'm going to ask that we acknowledge the resignation of Commissioner Worsecki's his term effective April 25th.
That a motion or you want a motion?
If you'd like to make the motion, that'd be great.
I'd love to make the motion to accept the resignation with regrets to Evan Worsecki.
9 seconds.
Effective the 25th.
Correct.
Thank you. If there's no questions or comments, can we do that in voice? Or you want to do it in roll call?
It can be.
On a voice vote, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Thank you, Katie.
Yep. And I just want to note too, I've heard through some concerned citizens that the way that it was being portrayed at certain townships, the process was muddy. So I just want to be very clear about the process, that the letter of interest and interviews are to appoint for a partial term, and then that individual will have to run for election for the remainder of the term. Commissioners are now on a 4-year term, so it is a little different than it was in the past. So the individual who is selected and chosen to serve will have to participate within the primary and general elections in 2026. So I just want to make sure that's clear for everybody.
If they're running under a party affiliation,
Mhm.
you have to participate, right?
All right.
Katie?
Yeah, absolutely. So I just want to highlight some opportunities we have with Benzie County for employment as well as volunteering. EMS, emergency medical technician, we're looking for EMTs specifically, and also paramedics. We do also have an opening right now in district probate courts, probation officer, collections clerk. So if there's folks who you know may be interested, if you go to our homepage, benzieco.gov, and click on employment and volunteer opportunities, those are listed right there on there. I also want to note that the Benzie Leelanau Health Department Board of Appeals, we're still seeking folks who are maybe interested in serving on that committee. So we do have vacancies there. We still hold 1 vacancy on the EDC as well as 3 on Parks and Recreation. There's 3 terms expiring. So if you know folks who want to serve on our volunteer boards and committees, please encourage them to apply with our office. We do have an application located right on our website under the employment opportunities and volunteer opportunities. They can get to it there. So just want to highlight that. We have published the RFP to potentially expand a Station 3 EMS station in Frankfurt there. So we're waiting for those proposals to come in. Hopefully we're successful in getting multiple proposals, and those will come before the Buildings and Grounds Subcommittee. During that time, I've also had a few conversations with Paul Oliver Hospital, talking about the property that is across the alley from our existing garage and has the house that we're currently staying in. Based on the conversations with Paul Oliver still intends to develop that area at some point, but they see the need of the house being torn down. They did not find deed restrictions on the properties per se. And so they are interested in the conversations of working with the county to establish potentially a parking lot there. There's parking needs at the Maples, there's parking needs at the hospital. So there may be an opportunity to work together to put some parking there because the plans of Paul Oliver expanding, they're indicating are probably 10 years out. And so to kind of fix that in the meantime, the topography of those properties is kind of weird, so I don't anticipate a huge parking lot, but it may address some of the parking needs because if you're down there in the middle of the day, people are parked all around the garage, on the grass, and so trying to, fix some of those parking needs. I also want to note that the daycare that is next door to where we're currently at is closed, and they vacated. They don't know why. They actually didn't even notify Paul Oliver. They found out through their staff who utilized that daycare. So they don't know what's going to go on with that house either. And so there you may see a lot of changes happening there across the street from Paul Oliver soon, between a Station 3 house being torn down in the future, potentially that house as well. So we are working on some of those conversations just to see if there's a partnership opportunity there, which would address some of the needs of not only us and Paul Oliver, but also the Maples.
I just want to add that we've challenged administration to try to get something done by the end of the year. I know you feel like that's a stretch, but stretch goals are healthy.
That's right. So it's published. I've received 1 email from a company asking a couple follow-up questions to the RFP. So I'm hoping that we get a great response. It's online. I published it in the Record Patriot as well. I also sent it to Ben to share with folks in Traverse City. So hoping we get a good response to it. The gym. So as you know, we offer an employee fitness center here on Benzie County that is for staff use as well as the resident troopers we have. It has come to our attention that we also have some dual employees that serve here. So they're technically employed by Manistee County, but they serve Benzie County either 100% or the majority of the time through that contractual partnership relationship we have with Manistee. And so we are going to extend them the offering of utilizing the gym as well while they're here. So I'll work with Rebecca Hubers on their key cards and that access. They'll sign all the appropriate waivers. We see this as they really are Benzie County employees. We are paying a portion of their salaries through the partnership we have with Manistee County for the shared courts. So they are a shared employee. So we're going to extend the use of the gym to those shared employees with Manistee County. We're in the middle of budgeting. Stephanie and I have sent out the emails to everybody to work through budgeting. Sorry, excuse me. So we're working through that. Here in a couple of weeks, we'll start sitting down with the different staff persons to really look at the numbers and where they're coming in at. And so then we'll have a better idea as to what next fiscal year is going to look like. Chip Johnston from Central Wellness reached out to me, and he is working on coming up with some funding to support the sheriff's office and having a bigger role in mental health transports here in Benzie County. So more to come on that, I anticipate, but he is willing to assist with any overtime costs or additional training to assist with mental health transports that are not necessarily a medical transport. We have received notice from the post offices here in Benzie County that they're making some drastic changes to their operations. So the post offices in Beulah and Benzonia are no longer guaranteeing overnight service delivery. If you need something overnighted or next day, you have to go to Interlochen or Grawn. They also have informed us that they do not have an afternoon pickup anymore, that the mail that we drop off at 3 to 4 o'clock is sitting until the next morning when it is picked up from the post office. So as you can imagine, the mail saga that has been going on in this building for 4+ years is just continuously boiling over the edge, right? So I know that the courts are very frustrated regarding this because they have a lot of timely mail through the court system specifically. And having someone having to drive all the way to Interlochen or Grawn by a certain time in the morning is really just, it's not conducive to operations. So that's what we're dealt with though. And so that's what we're dealing with. The courts are going to be driving to Interlochen or driving to Grawn to do their overnight mail. I have let the staff know that if they have special mail, they're going to need to take care of that on their own. Administration cannot be, driving to Interlochen for everybody. So we're working through that. We're being told that the post office changes are permanent. They're not saying this is temporary. So it's kind of it's the cards we're dealt right now with the post office. I'm not sure what to do. It's the nature of the beast of the world we live in, I think, is part of it. If there's more changes, we'll communicate that with staff. But for your purposes, just know that those post offices are not guaranteeing overnight delivery of your mail. It has to go to a different post office for that. Also, if you're dropping off in the afternoon, it's not leaving till the next day. It used to leave that same day, but it doesn't anymore. Broadband. So on your desk this morning, I did place a PowerPoint presentation that Tim Malone provided. So all of you have that related to the broadband efforts in Benzie County. He goes over his BEAD grant, the Robin grant. In that presentation, he does indicate the different costs and different services he's allowing for folks and the programs for folks for a low-cost version of internet. So really great programming in there. The BEAD grant was submitted, and so MyHigh is working through that whole process, but things look really great for Benzie County. Also, the Mitten grant is official, and we're working to call the first regional leadership meeting of the digital equity endeavor related to broadband the first part of June. And that will be held at at United Way in Traverse City because it is a 10-county region. So we tried to centralize that a bit. And that'll be part of the digital equity process, which is the $855,000 grant. Cherry Capital has applied for BEAD grant in addition to their facilitating the Robin grant. So still super strong momentum on the broadband front. From a county's perspective of that $200,000 that was allocated for some of the subject matter experts and consulting with that, we still have about $78,000 left of that budget, which is great because we still have about 2 more years, 18 months of the BEAD grant process, still working through that facilitation process as well. So we're in great shape, and our project is awesome. I mean, folks look to Benzie County all the time because this county is doing such great work in the broadband realm.
That is a great example of what happens when you surround yourself with the right people.
Definitely. And the final one, Axe My Tax, you guys already kind of went over that. Axe My Tax could be very detrimental to local governments. If that is approved at the ballot box, there is no tax levy allowed for any local jurisdictions. That includes tax levies for bond payments. So keep in mind that, educate yourself, encourage folks in the community to educate themselves. That proposal has made it through the hoops, and the petitions being circulated today are valid petitions according to Lansing. So those are valid petitions to put it on the ballot. The proposal does offer partial revenue replacement, but it's not total revenue replacement. And with that partial revenue replacement, it dictates what's considered allowable use of that partial revenue replacement. So for example, the clerk's office cannot be funded with any of that partial revenue replacement, period. Register of Deeds, nope. Treasurer, nope. So just keep in mind, educate yourself on that proposal. I understand none of us want to pay property taxes, but the idea of how they want to partially fund any replacement of revenue isn't going to fit well into local governments as well. And so how do counties, how do cities, how do townships pay for the services they provide when the partial revenue replacement is only allowed to be spent on police, fire, emergency management, and the courts? That's it. So that's a problem. So just educate yourself. I really encourage you to educate yourself, educate the community on what that looks like. It could be very detrimental to local governments, and that's a bit scary for many. So that's all I'll say on Axe My Tax. Is there any questions for me?
I got one for you.
Oh,
You brought it up. Didn't you have a discussion on possibility of the state taking over the courts?
oh yeah, that was going to bring that up. All right. So the state of Michigan has appointed a subcommittee of various folks from around the county or around the state. And they've done this in the past where they're auditing the court records and determining the cost of the courts and the possibility of the state of Michigan taking over the courts. And so we're working through this process. They are further than they've ever been in this process of establishing what that looks like. I'm being told by Mike Busanic, who serves on that committee, and he's from Monroe County, that it looks rather promising that the state will take over all or portions of the courts. Now, that doesn't mean the burden falls off the county from a cost standpoint. There will be a maintenance of effort cost that the counties will have to pay, and then the state would, pick up from there. It doesn't look good. It takes control away from the locals because it puts it into the state realm. And it also doesn't really give us much of an opportunity to adjust staffing or anything. They will tell us, this is how many staff you will have, this is what you will pay them, etc. And so it takes away local control, which is very scary for the counties.
They did that with the indigent defense,
They did.
and that just compounds every time you turn around. So I just thought it was interesting.
And there's a maintenance of effort there of 50%. We have to pay 50% of the grant that the state says. So there's going to be a maintenance of effort. There's going to be a cost, but we lose control of what those costs may be.
Didn't they base that cost on what you were paying up to that point?
Yep. So during the audit, Tammy and I submitted all kinds of records to SCAO, which was financial records, staffing records, time off, court document, everything you can imagine that contributes to the cost to operate the courts. We had to submit those documents for the past, was it 3 years?
Yeah, didn't
4
they say
years,
that
I
was
thought.
100%
4
funded
years.
for 3 or 4 years?
Yeah, and so we submitted all those documents. So they're doing that. Maynard Costerison is actually doing the audit on behalf of the state, which is who audits our financial records. So we haven't seen any reporting yet, but the county administrator in Monroe, Michael, he's saying that they're very near, publishing that data and seeing that through.
Well, two comments I'd make about that, and Katie, you're the one that alerted me to this, was the years that they're selecting were years where the courts may not have been as active. So that'll skew the numbers.
Yep.
Tammy, during the
COVID.
course of a given month, at least probably close to half of your activity is involved with the courts. How does this affect you guys?
Well, probably 85% of our activity is courts. And we were told they had told the Association of County Clerks that this was not going to take it out of the clerk's office, that it would still be the clerk's, because constitutionally we are the clerk of the court. And now we're hearing that they're saying something different. So
More to come, right?
more to come.
Definitely more to come on that. Mike said probably within the next 12 months, they'd have some hard numbers and reports to share with the counties.
Questions or comments for our administrator? If there's none, you have one piece of correspondence in your file. I'll open it up for the last public comment.
Let me respond if I could to the correspondence.
Sure.
We received prior to the meeting, a statement from Mr. Denvor, who's seated at the back about a situation he was in recently. And I we'd never received that into what was going on in today's business, so I don't anticipate any action. But I would like to bring it to your attention, and I'll follow up with Katie before too much longer and communicate with Mr. Denboer to see if we can kind of make sure this doesn't happen again.
I appreciate the fact that it was brought into the light. I do want to comment if I could. Some of my questions today were targeted at your concerns. And the reason why this isn't public is that we have got some HIPAA issues here with respect to things we can't disclose in public. So that's why it isn't part of the public record, right?
Yep.
Eric Van Duzen, Benzonia. With regards to your meeting with the MMRMA, some questions I would like you to ask them is with regards to the Henry litigation prior to the Henry estate attorneys filing a lawsuit against the county. A special legal services assignment was entered into with the unilateral authorization of your county administrator to allow for Cummins, McClory, Davis, and Acho attorneys to start investigating potential claims against the county before a lawsuit was filed. And that occurred on August 1st of 2022. And that assignment to Cummins and McClory required status reports initially after 30 days and then one every 60 days. Where are those? I watched your last meeting where you discussed you want status updates. Well, where are all those ones from 2022 to 2024, those status updates? Then after that, on February 27, 2023, still pre-suit, the law firm that represents the Henry estate sent a confidential settlement communication offer or proposal of negotiation to the Board of Commissioners. Never met with your attorney to ever discuss that. I don't know if you've all seen it. That's dated February 27, 2023. You've never met with your attorneys on the pre-litigation or post-litigation when that was filed earlier this year. Then you jump forward to after the lawsuit was filed. And then another assignment by MMRMA to Cummins, McClory, Davis, Nacho attorney, Greg Grant, the same attorney that was doing the pre-investigation. This assignment letter is dated February 7th, 2025, and says within 30 days of the assignment that they have to provide to MMRMA, not the county, who's actually their client, litigation action plan, litigation budget, 2, answer and appearance, 3, a monetary evaluation for establishing the loss reserve, 4, a detailed outline of your future strategy, 5, if the lawsuit involves civil rights, which this one does have civil rights allegations, and an evaluation of the plaintiff's attorney fees if plaintiff were to prevail. That's a huge issue, that number 5. I've discussed that with the chairman before. So where are those 1 through 5 bullet points? You know, your attorney filed a motion to dismiss in lieu of filing an answer from the defense in federal court in that case. You never met with your attorney. It's my understanding you're going to meet with Mr. Grant at some point here soon, but he's been working on this since 2022. And can I have 30 seconds?
Yep.
So other things to bring up with MMRMA is you have decisions that you should make, in my humble opinion. The first decision is whether or not to accept the assignment of Cummins, McClory, Davis, Nacho to represent you. You should ask MMRMA for the list of other approved attorneys that work with MMRMA to determine whether Cummins, McClory, Davis, and Nacho is the right fit and whether you're going to accept assignments that I believe are being shoved down your throat. And you're never even made aware that you have other options. The second thing that you should ask them for is a document called the Litigation Management Protocol. I've submitted FOIA requests for that document. It's my understanding, I won't speak for her, but the last time I talked to Ms. Seitz, she doesn't even have a copy of it, but I know it exists. So that's something you should have because you're the client. You should know what the protocol is with respect to them representing you instead of the insurance company, which seems like they're doing more often than not. Thank you.
Thank you.
Thanks, sir.
Other public input? If not, I'd move for adjournment.
Close public input.
Bob got it. I'll second.
Who motion?
All motion. Very supportive.
Very supported.
Yep.
All those in favor?
Aye.
Anybody want to oppose that?